area where we are, Richmond's pretty much the Golden Bay, proving to be a bit of a challenge as it is with everything.
You might want to tell Lindsay McKenzie he wants to mute.
Okay, Lindsay, we have you muted, please. Yep, all good. Okay, look, welcome everybody
it's
to
3 o'clock by my phone, so hopefully.
Yep, pretty much on the money.
Right. Okay, the meeting's about to start. Those on Zoom, can you hear us?
There was nothing. Oh, there was a wee discussion around the protocol.
Hello,
to be followed
Zoom
at these
members.
two meetings, and both chairs indicated that they'd probably revert more to a structured debate rather than let it ramble, given the topic.
Right, Zoom members, can you hear us?
Yes, I can.
Thank you. Right. Okay, we'll restart this. We've got live streaming now, so welcome everybody to the Tuesday, 7th December 2021 Infrastructure Services meeting. We have Zoom attendees, Lindsay McKenzie, we have Councillor Soper and Councillor Abbott. We have apologies from Mr. Jeff Grant. We don't have a public forum today in this committee, and we would like to accept a minor late item for public excluded, and that is a verbal update on City Centre Streets, update on S Street. Reasons being noted. Can I have someone please move?
I can do that, Chair.
Thank you. Councillor Lewis, second. Ms. Coote. Thank you. Put that. All those in favour? Against? Right. That takes us to the first item, which is the minutes of the Infrastructure Services meeting Tuesday, 2nd of November. Can I have someone move that? Will we receive that, please? Thank you, Councillor Arnold. Seconded, Councillor Skelt. Put the motion. All those in favour?
Aye.
Against?
Aye.
That is carried. Right, now we move on to the Three Waters section here. Okay. Recommendations for the Three Waters items are that we receive the report from the lobby group, that the committee determine if it does not wish to join the group, and if the committee does decide to join the group, it authorises $15,000 towards this group, and also no doubt signs the MOU. Right, so I'm going to, before we open up for debate on the subject, be running a standing orders so that each member of the committee gets to speak once on the substantive motions, but you may ask genuine questions at any time for clarity. Also, under standing orders, Councillor Clark, bringing the notice of motion to this committee, gets to open the debate, and he also gets to have the last say. So, without further ado, Councillor Clark, I'll let you.
Thank you, Chair. And you already mentioned the recommendations that are in the notice of motion. Just want to read through the background for some of those people that might be live streaming that don't have access to the agenda and some of the attachments. I'll just briefly go through that. It'll just take a couple of minutes. So the background is that there's a great deal of pushback from councils across the country on the government's Three Water model, with only 7 of 67 councils fully supportive of the model. It seems that all councils support the direction of government to improve drinking standards and also to improve the environmental outcomes of wastewater discharge from water to land. What many of the councils do not agree with are, and there's a list of those, that the way to achieve the government direction and outcomes is not by the current model of 4 entities. The councils will cross-subsidise each other within each entity, so one will pay for the other. And so there's some winners and losers in that game. A lack of priority between growth and maintenance needs is not clear, so those that have high growth may get that at the expense of councils that are doing well, like our council, that may need maintenance work. That the ownership of the three water assets has shifted to a joint council ownership. That the entity of the governance group for the South Island entity has 21 councils but only 6 votes. This undermines individual councils' control as opposed to ownership. That the co-governance model with mana whenua, which gives equal governance and control to councils and mana whenua, so they have 6 votes each, further undermines local control. That the original MOU signed between the DIA on behalf of the government and the councils allowed for an opt-out provision, and also clarified that we had an ability to engage with our communities about this reform. That Minister Mahuta and the government have defaulted on both of these MOU commitments by mandating the reform model. Sitting alongside these concerns is the lack of advocacy by our parent group, Local Government New Zealand, on behalf of each council. LGNZ has recently acknowledged and apologised in our Zone 5-6 LGNZ meeting for their undertaking of 2 actions that have alienated many councils. Firstly, they, the LGNZ and the national zone representatives, have changed the focus away in dealing with DIA from advocacy to partnership. And secondly, they subsequently signed a heads of agreement with the DIA, which is a 20-page document, without consulting with member councils. And that document had a section 4 that restricted and prevented any negative comment by LGNZ around the Three Waters reform. And finally, LGNZ have accepted funding from the DIA without consultation with member councils. With allegations in the media, this funding is to support the promotion of the reform. I've raised this concern twice with Stuart Crosby, who's the LGNZ president, and he has committed to making contact with each council to clarify the nature of that funding. Because many see that as an inappropriate gesture to accept that, given Section 4 of the Heads of Agreement, which restricts criticism. No contact has been made to member councils in the last month. Those who have been keeping in contact with the developments of other councils will have observed the results of their public engagement. My observation of the community engagement by Waimakariri and by Manawatu are that both councils gave a balanced picture to their community. The community feedback for both resulted in support for improved water standards and wastewater discharge, but overwhelming opposition to the water entity solution. That opposition was around about 95% in both cases. In light of those concerns by council and the frustration at the lack of advocacy by Local Government New Zealand, a group has been formed to lobby for changes in the reform delivery space. And you'll see the attached memorandum of understanding from Helen Warboys, the Mayor of Manawatu District Council. This group is not formed to replace Local Government New Zealand, but to advocate for a review of the water entity approach, which includes lobbying and media campaigns. I believe this group will have a strong voice with government and will also position Local Government New Zealand to return to its advocacy role for the next 2 local government reforms, which is the future of local government and the Resource Management Act reform. I note that Local Government New Zealand in the last week has recently put out their forward strategy, and that is now sprinkled with advocacy wording, which is positive. I believe we should be involved with this group, and therefore I put forward the 2 recommendations. And at the same time, when we do get to vote on it, I would appreciate that the vote be called on a division. Thank you.
So we can do that. Okay, thank you, Councillor Clark, for that introduction. Okay, I'm going to now open the meeting for comments or questions. Councillor Ludlow.
Question. Can you tell me how the amount of $15,000 has been determined by the group and from which budget we intend to find this money? Because it's not a small sum.
Sorry, do you want me to answer that?
Well, okay, I guess the use of the money, Councillor Clark, if you wish to take that first part.
Well, I guess that they're working on assumption that they'll get around about 30 councils involved, 20 already signed up, and there's probably another 20 like us that are considering it. So they're looking at an overall program where they will have TV advertising and media advertising to explain our position on our differences with the DIA going forward. and push for better outcomes. On the issue, where do we find that internally? Well, I guess that's not my call. I have a view on that, but if you ask me to view that, I can give you some.
Okay, I'll just pause there and Madam C.
Mr. Chair, the suggestion is that if you determine to join it, then you refer it to the next quarterly report as unbudgeted operational expenditure that should be allocated a code from an underspent budget
Right,
line.
okay, that's, you satisfied with that answer, Councillor Ludlow?
Yes, I am at the moment. Thank you.
Okay, right. Ms. Cook.
Can I raise a concern about the wording used to characterise the involvement of mana whenua on the water bodies? We are local. We have been local for more than 1,200 years. We are also ratepayers. We are also business investors. I do not see that mana whenua sitting on a group should be seen as not being part of a open and democratic process, because by definition we are constantly under scrutiny. I think that the characterisation of us as being other is actually really harmful to the debate that we are having, and I would urge that the groups using this be encouraged to think again about how they use their terminology and what they use it for, because this is a very divisive way of characterising what the process may be. There will be councillors, there will be lawyers, there will be doctors, there will be politicians, there will be all sorts of people who are represented by the people who sit on those boards. And just because they're brown doesn't mean to say that they don't have acumen, that they don't have a vested interest in the communities that they come from and live in. We should see this as progress, not a threat. Thank you.
So do you see anything in the MOU that you wish to change?
I'll reserve my comment on the MOU, thank you.
Right, okay, so you're just raising that as your statement?
I want it to be noted, thank you.
Okay, no, that's fine. Councillor Munson.
Yeah, just following on from that, I note that the comments which Ms Cook is referring to are the comments that are written in Councillor Clark's notice of motion, but I can't actually see them specifically listed or identified in the MOU, so I am interested to know whether this group is going to be lobbying against this specific element of the government's plan or not, because I certainly will have no intention of voting for something in favour of something that would be challenging the co-governance model.
Well, I see in the MOU no evidence of that.
No.
At all.
I can't find it.
Okay, and as you said, this is Councillor Clark has just listed some of the issues that have been brought up, and there's no doubt that that issue has been brought up. So to deny that it hasn't been brought up would be wrong not to put it there. Whether it's right or not is another issue.
So will it be forming part of this group's that's planned challenge to the government is my question.
Well, we can't answer that because the MOU does not specifically state that, and the fact that the main issue is working with the government over things, so nothing is specific. Councillor Lewis.
Chair, in the MOU, the one statement does actually say, if I may read it out verbatim, that the co-governance model with mana whenua, which gives equal governance control to the councils / at mana whenua, further undermines local control. I think that could be a paragraph of concern to Ms Cook.
Okay. Councillor Crackett.
I mean, if we look at the principles of why we're actually considering to support such a thing, taking what Ms Cook has rightly said and placing that aside from this argument at this point, this council has really expressed displeasure at the way that the entire Free Waters rollout has come about. is there a possibility that we can go back to this group that obviously what they're lobbying for and state our position on it, and that we would absolutely not, as a council, support, as Ms Cook has said, the inclusion of those principles, strip that out of it, and then gain some clarity on whether or not that's a possibility?
Well, I mean, this is just for an update on what's happening. I know that Dunedin, when they've spoken about this, have spoken very strongly about the governance, the actual governance model not being an issue. Christchurch has also spoken that the governance issue, the governance thing is not an issue. So the issue with the main councils is about taking the assets and the way it's going to be controlled that way. So they have no problem with the governance. It's just the model they have the problem with. So I don't want to get too focused on the governance side, because even though it is important, it is not the essence of what's happening with these entities. Okay. Further councillors? Okay. Well, before I give it,
I have my hand up here, Mr.
oh,
Chair.
sorry there, Councillor Soper. Councillor Soper, the floor is yours.
Thank you, Mr. Chair. I wanted to speak on this particular motion because I'm not comfortable. I agree with Ms Cook's comment, and I'm sorry, but I don't agree with what you have said. As Councillor Lewis has pointed out, there is a concerning reference to the governance issue in the MOU agreement, but setting that particular issue aside, I'm not in favour of joining this group. I think we do have to bear in mind that a working group has been appointed, and they do carry a mandate. That working group is a very representative working group. I note that Mayor Dalziel is on that working group, Mayor Goff, Tim Cadogan locally. That working group has been given the mandate to look at all the issues that are being talked about here through this, I'll call it a so-called ginger group. I really cannot see the benefit that we would get paying $15,000 to belong to a group. We're not quite sure of how many councils are going to join it. We're not quite sure what it intends to do in the way of TV and media advertising. I do have that concern about the position it will take on the governance issue and the involvement of mana whenua. I would be very uncomfortable to see our council join this particular proposed group, and I will be voting against that being done.
Thank you. Anyone else wish
Yep.
to? Yes, Councillor Abbott.
Oh, thank you for that. I agree with what Councillor Soper said. It seems to me to be a duplicate of the governance, and the governance that are proposed have the same mandate. So I don't see a point in spending $15,000 for the same mandate.
Okay. Thank you for that. Right, anyone else wishes to speak?
Yes,
Yeah.
thank you, Mr.
Yes.
Chair. I agree with Councillor Soper as well. I think that $15,000 isn't much really when you look at the costs that are going to be involved whichever way you go. And I think you've just got to accept that the government was voted in. They made it clear they'd be engaging in reforms, especially those related to the environment, and they won. And they, I think, have a democratic right to therefore impose their will. And they're going to, I think, probably give a few token gestures towards the group, but the strength is in the big councils and what they're going to do rather than a lot of minority councils.
Councillor Arnold.
So it's not a popular decision, I know, but I think it's the right one.
I support the motion here, the recommendations, and the reason being is I think it's our duty to do all we can to preserve the assets that our community's paid for and, you know, worked for over the last 100 or so years. I mean, we need to do all we can to preserve our ownership. We've got good assets. I don't want to see us funding councils that haven't done that. Our ratepayers have done that for us over the last 100 years, and I think it's our duty to maintain that management of it. So I support doing all we can to ensure that happens, and I don't necessarily have a great deal of faith in the working group as it's been set up by the government.
Okay. Councillor Adler, you're here with your statement.
Yes, I've had my question. Thank you, Chair. I'm uncomfortable with the proposal for a couple of reasons, but I also understand the rationale behind it, because we are concerned about the process and what was originally promised and what is now being mandated, and I do have an issue with that. What I have a concern with is the potential for us as a member organisation to undermine LGNZ, and I agree that they have not handled the situation as well as they could have done. But that's a longer term involvement for us, and I guess it sets potentially a habit that could be formed with some of the other issues that are coming up. If I hark back to the previous chief executive of LGNZ, Malcolm Alexander, when he went around councils, he said that they're a member organisation representing our sector to central government, and it didn't help them to advance a cause when there were 90 different points of view going forward behind what it was they were being asked as an organisation to do. I think we've got a little bit within our own house, the LGNZ house, to do to tidy up, but I really am nervous about the potential damage that being part of this process does, and also the language around the co-governance model. I'm not comfortable with that at all.
Okay. Councillor Kett.
Yeah, thank you, Chairman. I support the motion. I'm old enough to go back to the early days of Invercargill City Council when we had a city engineer by the name of Ken Ballinger, and him and his staff, and over the years, I think Ken started with us in the 1950s, early 60s, and we have a well-maintained infrastructure that includes stormwater, grey water and drinking water. What I'm upset about, that Minister Mahuta has quoted quite often, saying there are over 30,000 New Zealanders become very ill drinking substandard water in New Zealand that is supplied by New Zealand local authorities. Well, I haven't heard anyone getting ill drinking water from our water supply, and I'd like to ask our Director, Erin Morgan, if she can make a comment to this, if there's been any reports on our locals or visitors becoming violently ill drinking our local water.
Do you want me to answer that, or do you want to answer?
Look, I'm happy. Definitely during my time here, there's been no such reports, and nothing that's been made that I've been aware of in our recent history either.
Thank you very much. That's the answer I thought I would receive, but I had to ask it. And I believe the $15,000 is a small amount to support those other councils, so I'm in favour of them.
Thank you, Councillor Kett. Councillor Crackett, you've got your statement now.
Yeah, it's just going to be a short one, because we've litigated this in the first instance and quite a few times, but our feelings or our sentiment on how the government has handled Free Waters. I support, like Councillor Arnold here, actually, that anything that we can do to preserve the legacy of our forebearers is, and for the future of our mokopuna, is something that I personally believe we should absolutely be doing. However, it's not quite clear enough for me exactly what that $15,000 would be contributing to, and I'm really uncomfortable with the sector there that does reference the co-governance structure, and any inferencing that mana whenua shouldn't have a voice at the table is just not something I can support. So I think it's going to be a no from me.
Right, anyone else? Okay, I'll jump in before I pass it to Councillor Clark. Now, what Councillor Arnold has raised is something very important, and if you look at... Sorry? Councillor Soper, have you got a question?
I had a question, Mr.
Yep.
Yes, I do have a question, partly inspired by what Councillor Ludlow said. The question that I did have in the back of my mind was, if we did join this group, has any reflection been given to the undermining this group could result in doing to our GNZ when we have such important reforms as local government reform and RMA still very much on the agenda in a very short time?
Well, I don't think we have anyone here to answer that, but in my view, there would be it would have no impact on that whatsoever. This is a separate issue. It's an important issue and has nothing to do with those other subjects you've raised. That is my view on it, but I don't think there's anyone here who can answer that. Okay. Hold it. Just a moment there. Yeah, Claire has read in the by Mayor Warboys, the desire is not to have a negative impact on the relationship with LGNZ from member councils. Okay. Right.
Thank you. I'm not the...
Yeah. Councillor Lewis.
I know I made a statement, which that was just not a comment about my voting. I just wonder, if we vote for this, are we then questioning effectively the ability of the advocate group that's been set up, or suggesting, or they have no authority to actually mandate anything that comes out of their discussions? Are we actually questioning their ability?
No, I think this has been stated as a separate group that will be asking different questions and putting forward different alternatives.
Would we be contributing to that?
Well, I imagine the MOU gives us that opportunity to contribute, yeah.
So in other words, if we vote for this motion, we'd be doubling up on that.
Doubling up on?
Doubling up on their ability to ask us questions, the need for them to ask us questions.
Well,
are we revisiting it twice, or revisiting it?
No, I don't think so. This group will be doing completely different things to what that other group with LGNZ is doing.
Next year.
Councillor Cracker, another question? No, you don't give answers to their statements. Sorry.
Councillor Lewis's question.
Right. Looking around the table again. Right, I'll just start. Councillor Arnold raised the point that we should do all we can as elected members, and he's dead right. The very first item in our code of conduct of values states that we do what's best for the city. And I believe that the proposal for the Three Waters entity is not in the best interest for this city at all. And if you look at the financial information that was put forward by our financial team that showed what it would cost per ratepayer in the year 2050 something versus what the DIA put forward, they were virtually identical, except in our budgeting over that period of time, we had included $90 million on getting wastewater solution to land as instead of a discharge to the estuary. So there alone is a $90 million gap. They're doing business as usual in their financial proposal to us, we've got all this extra work done, which we will not get. The other thing is that Minister Mahuta says there'll be 9,500 new jobs. Now, this baffles me. How do you do something so much more efficiently and cheaper and create 9,500 new jobs? Now, and these guys won't be working for charity, these new 9,500 positions. So the maths, again, what I'm seeing us heading for is something like Kiwi build on a biblical scale. The LGNZ group is really not a group advocating anything new. It's rubber stamping. It's basically a Clayton's group that will see this through. So my view on this, it is not good for Invercargill, and that's what I'm here saying. And I'm voting for what's best for Invercargill. So, Councillor Clark, I'm going to pass it back to you.
Yeah, thank you, Chair. Just a couple of reflections on what's been said. Listen carefully. No suggestion from the members of the new group that mana whenua doesn't have a voice. What is of concern is the size of that voice. So that's the issue. The issue is not one of partnership, it's one of co-governance, which some of those councils do not agree with. And so just give you an easy example of that. All significant decisions made by the water entity in the South Island need to have a 75% stakeholder approval. Given there's 12 votes, so 6 represent 21 councils and 1.2 million people, and the other 6 represent mana whenua with about 50,000 people representing them. Mana whenua can veto just about everything that's of significance. And so that's an area of unease. And so what they're saying is if you're going to have 12 votes, maybe the split should be 9-3, so there's not that veto right. So I'm just reflecting what I'm hearing from other mayors. Everybody tiptoes around this issue because there's an unease about talking about it, but you need to put it on the table to be able to deal with it. The MOU that's promoted for the new group is quite clear about where it wants to go. It has an opt-out clause at any stage. It does not bind us to anything. We have a voice on every issue, as opposed to local government tends to have representatives for zones, and so our voice is not often heard. In this one, we will have a voice, and we can certainly have a voice on mana whenua and anything else that we want as well. But the key issue is the solutions that have been thrown up by the government. On the issue of the 15,000, I think that's a very small amount to a council that operates over $100 million a year. And if you cast your mind back earlier in the year when we got the first Thompson report, we committed $750,000 to that reform process. We haven't spent anywhere near that amount. We've got money in the budget for that. And so I didn't hear anybody complaining around the table about the $750,000. So the 15,000 is quite small. The other issue is the issue I think a couple of my colleagues raised about what about future reforms? Well, we have 2 reforms that are facing us. RMA reform, and by my way, the most important one, even though not the biggest, is the future of local government. And with the current heads of agreement that's in place between Local Government New Zealand and DIA, I'm not clear that doesn't run across more than just the Three Waters framework. And if it does run across, and I expect it does, we will have an advocacy group that's not allowed to publicly criticise the government on anything. So I don't accept that's a good mechanism going forward. This group, however, is not here to undermine local government New Zealand. It wants it to work better for us. So hence why I put the 2 recommendations.
Thank you, Councillor Clark. That's all done and dusted now. I'm sorry, Mrs. Cook. We had an opportunity for before. No, sorry about that. That's the way standing orders work. So I'm now going to put the motion. All those in favour?
Need a mover.
Yeah. Okay, sorry. I'm going to move the motion that...
and second?
Actually, I'm going to let Councillor Clark... Do you want to move the motion?
I'll move. And by division, please.
Yeah.
The recommendations are looking for direction.
Yes.
You'll need to.
You are moving the notice of motion.
Yep, I am.
And that is the 3 listed there. Sorry about that. It's the 2. The 2 listed there. Sorry about that. Okay, and we have a seconder for that, please.
Yes, yeah.
Councillor Keat is going to second that. Okay, it's the notice of motion. The ICC agreed to the attached MOU and become a partner council for the purpose of advocating for a different solution to the government's 3 water, in brackets, water entity reform, and that ICC commit to the $15,000 partnership membership fee. So again, the seconder was Councillor Kett. Right, I'm going to put that motion now. Okay, I'm going to call for revision. So can you please show hands when you vote? All those in favour?
Aye.
No one on screen. I have 6 people voting in favour. Councillors Clark, Lewis, Arnold, Scout, Kett and Cottinger.
Okay, we have that. All those against? 7, 8, 9.
Thank you.
Okay, that has been defeated. Thank you for people's time there.
For my benefit, Chair, can you just confirm how many were in the opposed?
Nine.
Chair, I have 9 against. Ms Cook, Mrs Coote and Councillors Ludlow, Amundsen, Lush, Crackett, Shadbolt, Abbott and Soper.
Thank you.
Right, thanks for that.
Chair, do we now, I think it's still appropriate that we move that the committee receives the report.
Okay, if you'd like to move that.
I am.
Second.
Thank you. I'll put that we receive the report. All those in favour?
Aye.
Aye.
Against? That's carried. Right. Okay, I think we're stopping a road now. Let's move. Did you find out about that? Okay. Welcome, Heather. Stopping of the Lagan Street Road, Bluff.
So council have been approached by an adjacent property owner to commence the road stopping process in view of purchasing that parcel of land next to them. The parcel of land is at the end of Lagan Street. We are opposite the entrance to the Bluff Cemetery, quite a wee way up the hill. Preliminary investigation of the title and how council received the land doesn't negate it from being stopped, and so we're asking to start the process of the road stopping.
Okay. Councillor Ludlow.
Thanks, Chair. A question. So I have no problem with being asked to stop the road and to go through a process of disposing it, but aren't we obliged to, if that's the case, to send it to market rather than just negotiate with an adjacent property owner?
We have not received an offer from an adjacent property.
So we'd put it to market.
And it would go to market.
Thank you. Thanks. I'm
Okay,
happy to move the 2 recommendations then, Chair.
Okay, thank you. Look, I've just got one question that was alluded to me by a member of the public, and that's, is there potential that part of this land was the old Bluff tip?
That is not anticipated that it was.
Right.
It's quite significantly up the hill, and that will form part of the process for the investigation of the road stopping and public consultation.
Yes, Councillor Lush.
Is the size of the section, does it qualify that an individual dwelling could be built on that? Does it stand as a section in its own right, or
I
just?
believe so. 800 plus stairs.
I believe that section actually backs onto the Barrow Street, is it Ban Street sections that run in parallel to, behind this?
Yes, there is a piece of land that has been previously stopped and disposed of, which runs further down the hill, and this one is the.
I was trying to see the whole picture, you know, to see.
So where the entrance to the Bluff Cemetery is?
Yeah, I understand where it is.
Yeah.
It's the sections that like run down behind it, and then there's that road that's beside that.
I'll
That
let,
backs into that.
sorry, I just interrupt here. Councillor Soper has left the meeting.
She may have connected.
Councillor Soper, sorry, we lost your video.
Sorry, I had to change the space I'm in the DHB offices.
Okay, no, that's
Sorry about that.
That's okay. Yes, Councillor Lush.
Can I make a comment as well as?
Yeah, absolutely.
Just having gone and looked at that section yesterday, it's one of the very few sections in Bluff that can see both the harbour and the ocean. So it's a very, very significant and desirable section as well too. So I think that needs to be noted. It's not just a yeah, it's a bit of land that has an extraordinary aspect. So particularly for a town that's short of sections, I think it would be a desirable place for someone to put a home. So.
Okay, any other questions or comments for Heather? No? Right, we've got the two recommendations there, and they actually, we received the report, but it will go to open market. Do we need to mention that at all? Or?
That is anticipated to go afterwards.
Right, but we don't need to include it in the resolution?
It will come back to council.
It will come back to council. Okay, then in case we have the two recommendations there. Can someone please move that?
I did.
Oh, you did?
Seconded.
Seconded on Zoom by Councillor Abbott. I'd to put that, all those in favour?
Aye.
Against? That is carried. It takes us now to activities reports. And Erin, do you want to start with that? Thanks.
Thank you, Chair. I'll split this into two sections, the leisure and recreation section and the infrastructure section. Just noting though that Steve Gibbling, who would normally provide any comments in relation to leisure and recreation, is absent. And so we have Caroline as our parks manager here to provide any answers that elected members may wish to ask. So I'll start, if Chair's happy, by opening the floor on the leisure and recreation section.
Yeah. Yes, Councillor Emerson, yeah.
Just a comment, thank you very much for the explanation about what's happening with the Chinese garden. I recently went through a walk through there expecting to see it, you know, all beautiful and growing up after opening, and was a bit concerned with what I saw, but now that I've got an explanation, thank you very much.
Any other questions? Yes, Councillor Allen.
I've just got one, well, it's not really a question, it's just a comment. I'm looking at the interments and cremation, and am I right in interpreting that since the pandemic started, their death tolls dropped from 700 down to 250? Is it, was that sort of showing there? Like your interments, you know, in the cemetery, you know, I know it's showing cremations as opposed to
There's a lot less.
As to burials, but the whole thing looks like the total death rates, right? Like right down from sort of 700 per annum down to 250.
I see you got a scooter too.
That's a very
yeah, look, we can't. Mr. Day might want to say something here.
Thank you, councillors. Look, not my area, but the challenge with the report is that is a year-to-date figure. So what you're comparing the other 4 years is the 4 years full 12 months. That year-to-date is only up until, I believe it's the end of, it's financial year, so it's only about 5 months worth. So there's another 7 months to go.
That's quite good because it's better than the road toll, the entire road toll in New Zealand.
There's more to live for here
Keep
now.
sanitising and wearing masks.
I think the intention is to show the rise in cremations.
Right. Councillor Clark.
Yeah, thank you, Chair. Just as a comment for future activity reports, I wonder whether we could get a report that includes the progress being made on Anderson House.
I think we had one last activity report.
I'm happy to provide it.
Oh,
Yeah,
here we.
thank you.
Oh, no, nothing further on leisure and rec.
Okay, thank you.
Okay, so just a couple of points I'd like to make on the infrastructure component. One just being that since the report was put forward, we've had further confirmation back from Christchurch City Council with regard to their wastewater treatment plant, the potential to use some of the aerators that we had out at Clifton. They're looking to take 2 of the smaller aerators that we had on site. So we'll be drawing up an agreement to make sure that if the worst happens and we suddenly require those, that they would be able to swiftly be returned to us. But we also wanted to make sure that from an environmental perspective that we were able to help Christchurch City in whatever way we reasonably could. The other piece is just a note that you will have seen the new parking machines going out around the city, and just a reminder that the go live date for those is Monday the 13th, and that there's been quite an intensive piece of work done in terms of briefing our internal team and having that team ready with all of the information required to be out on the streets assisting customers next week. And the other piece around, just a quick verbal update around Anderson House. So the work is underway. The scaffolding has been completely erected. They are in the process of removing or lowering the first chimney, and work is underway on removing the cladding from internal walls for the strengthening work that needs to be done internally. At this stage, the project's on track, both from a program and a budget perspective. And we've also had a recent site safety audit with good results at that site also.
Thank you. Right, any questions on that side? Councillor Crackett.
Got a question that's more to point out something that's already existent in the report. I've seen a lot of rhetoric online about our fantastic new parking solutions, sort of saying, like, being a bit negative about it, going, oh, this is another way to get more money out of us, and rah, rah, rah. But can you confirm for me just how much free parking that a user will get per day, and what the hour cost is currently? Is it cheaper? Is it more expensive?
So sorry, in the absence of Mr. Pearson not being here today because he's unwell, I'll talk to it at a reasonable level. Obviously, there's an initial period of 30 minutes of parking at no charge, which is different to what we've had previously. Then for those shorter stays where you're popping into the shop for a half an hour, an hour and a half, the parking would on average be cheaper than what you would see at the moment. That being said, if you were looking to park right outside of the shops and be there all day and go to work, perhaps, then you would find that it would be a more expensive charge, and you would be most likely better off in one of our various parking buildings that we have around the city. But very much the aim is to support local business in terms of keeping those parks turning over. Definitely time for people to come in, visit different stores and leave again, but looking to discourage that all-day parking out in those prime locations.
Thank you. That answers my question. That's exciting.
Okay, everyone's good there. Right, thanks. That brings us to the end of the public session of the infrastructure meeting. Now, it's just a procedural thing that's going to happen here, so I'll ask everyone in the public gallery to stay. You don't have to leave at this moment. So we're going to, can I have someone move that we go into public excluded, please?
For sure.
Ms. Cook. Thank you, Ms. Coote. And that's with the knowledge that we are receiving that minor item. So I'll put that. All those in favour? Aye. Against? Carried. I will now adjourn the public excluded meeting. And you'll have Councillor Ludlow up here.
And we'll deal with it.
Who's this?
I think we'll go back to home if you like.
Andrew asked you to get a PowerPoint ready. Councillor Pottinger.
Yeah.
And I think there's still a staff seat up over here. Right, councillors, staff, members of the public, welcome along. I'll declare this extraordinary meeting of the Performance Policy and Partnerships Committee open, acknowledging, of course, that we are also on Zoom and streaming. Welcome on Zoom to Mr Mackenzie and councillors Abbott and Soper. We have an apology from Jeff Grant. Would somebody like to move that that's received? Councillor Lewis, Councillor Scout, put that all in favour. Against, carry. First item will be to receive a submission in public forum. Then I'll go through the ground rules for the receipt of the paper and the discussion that's going to follow. So first of all, if we've got Sophie and Ewan, is it? If you'd like to come up, there's a table at the middle there. Welcome along. The floor is yours, yes.
Okay. Hi everyone, thank you for taking the time to listen to us. Can you hear me okay?
Yep.
So my name's
Sorry, no, Councillor Abbott's shaking his head, so if you could pull that in.
Better?
Can we just check that it's turned on? One moment.
How about now?
There we go.
Better.
Thank you.
So my name's Sophie Feebry. I've recently moved to Southland. I've been a doctor for 16 years and a rural GP for the last 9 years. And I have 2 school-aged children. And does everyone know this is in regards to the decision about whether the unvaccinated people can go into places? Yeah.
Only thing we're discussing.
Cool. Just thought I'd make that clear. So I'm going to talk about a few things briefly: the severity of the pandemic, the evidence around the effectiveness of the vaccines to reduce transmission, and some reasons why some people can't be vaccinated. So firstly, I'd like to acknowledge the fear that has gripped the country since last March. I myself was initially terrified of COVID-19, and I was in fact the one who started the Masks for All campaign last year with Michael Baker. The good news is that as more data has come out about COVID-19, it's clear that it isn't the Ebola-like plague that we thought it was last year. Turns out that the death rate from COVID-19 is around 0.15%. And if you're under 70 years of age, it's only 0.05%. The even better news is that there's a number of preventative and early treatment options available, such as vitamin D, zinc, vitamin C, inhaled steroids, and a number of others. So with a death rate similar to a moderately severe flu and early treatment options available, the question needs to be asked, are all these measures and the segregation of society justified? The next question that should be raised is whether the current COVID-19 vaccines actually prevent transmission of COVID. Last year, I held out much hope that the vaccines would promise the end of the pandemic. This year, I've lost faith in vaccines as the solution to the pandemic as I've watched the scientific literature. So an important study from the European Journal of Epidemiology, which I'll leave with you, compared data from 68 countries and 2,947 counties in the United States. In this study, the authors compared vaccination rates for each country with the COVID-19 cases per million people. They concluded, there appears to be no discernible relationship between percentage of population fully vaccinated and new COVID-19 cases in the last 7 days. In fact, there's no evidence that this vaccine reduces transmission. A study from the UK showed that household transmission rates of COVID-19 were roughly the same, regardless of vaccination status, and I'll leave that study with you as well. So why is this? Why do vaccination rates not seem to correlate with COVID-19 rates? And why do studies show that the vaccine doesn't seem to prevent transmission? We have a couple of reasons. So firstly, this is not a sterilising vaccine. A sterilising vaccine is one that absolutely stops you getting the disease and passing it on. Measles is pretty good like that. This is not a sterilising vaccine, and it wasn't designed to prevent infection. It was designed to reduce the severity of disease if you did get it. The vaccinated can still become infected and pass on the virus. And I'd like to quickly read something from a Ministry of Health guideline that came out to doctors. Ministry of Health position statement on the management of unvaccinated individuals in healthcare settings. On page 3, they just mentioned when there is high COVID-19 vaccine coverage, above 80% of eligible people, transmission is more likely to occur from a vaccinated than an unvaccinated individual. And that's in the Ministry of Health's document, which I can leave with you. Secondly, the vaccine effectiveness wanes with time. An Oxford University study showed that vaccine effectiveness decreases by 22% per month after vaccination. By 6 to 8 months, the vaccine is doing almost nothing. Thirdly, the vaccine was designed for the Wuhan variant of the virus, which was 2 years ago. It's expected that viruses will mutate to escape the vaccines, just like bacteria mutate to escape antibiotics. Delta appears to be a moderately vaccine-resistant variant. Studies showed that the vaccines were much more effective against the Alpha variant compared to the Delta variant. And in fact, recent studies show that those who become infected with Delta have similar viral loads, that's the amount that you carry in your upper airways, regardless of their vaccination status. Many studies have confirmed that viral load thing recently. The final point I'd like to raise is that in my professional experience, most people who are not vaccinated have very legitimate reasons for not taking the vaccine. Some are people who have had significant reactions to the first shot and understandably are reluctant to get another. Some are people with personal or family histories of heart conditions, blood clotting, cancer, or autoimmunity, and they're waiting for long-term studies to confirm that it's going to be safe for them. Amongst my own patients, I have personally seen autoimmune flare-ups, worsening of cancers, heart attacks, and blood clots after vaccination. The Ministry of Health will not give exemptions for these reasons, but as a medical doctor, I see these as legitimate reasons to be cautious about taking the vaccine. No studies have been carried out to assess effects on fertility, so I can understand that people of childbearing age may be cautious. And many people with religious convictions do not want to take vaccines that have been tested on aborted fetal cells. These are just some of the reasons that people in our community remain unvaccinated, and there are many others that are just as valid. So to recap, COVID-19 has a fatality rate in the ballpark of a moderately severe flu. There are early treatment options available. The vaccines do not prevent transmission, and there are some very valid reasons that people can't be vaccinated. So I therefore see no medical reason that the unvaccinated should be excluded from these important places in society. And just a final point, it was really interesting to hear the discussion on the three waters, and thank you for letting us listen into that. And I think we might be able to all agree that we're in a period in which the power of local government seems to be reducing. But I would be proud to see the Invercargill City Council resist that. Thank you.
Thanks, Sophie. We have time for a few questions if there are any councillors. Councillor Lewis.
Oh, Nikki was going to speak as well.
Oh, my apologies.
Yeah, sorry.
I was told there was one speaker.
Oh, sorry.
Apologies, sorry. Okay, my name's Nikki Harrison and I'm a registered nurse and a Southlander. I endorse measures to limit the impact that COVID-19 will have on our community, but I have concerns for individuals, valued contributing members of our community who will be disadvantaged by any policy change regarding passports only in public facilities. The impacts of segregation and discrimination are going to have profound and long-lasting effects. Excluding people from public facilities that they pay for with their rates or through rent is discriminatory when for reasons outside of their control they cannot safely take the vaccine. Some people didn't have a choice of being fully vaccinated. People require access to these important public facilities. Libraries have been recognised as essential to the community, hence why they are publicly funded and accessible to all. Children learn in a supported education and personal interests. Adults are able to support the education and skills. People can join social groups. There's important public events, networking, and essential community. Free internet ensures digital equality and access for all of society. If we lose this, the consequences of lost access to education at all levels will be felt for years to come, and wholly recovering lost education is unfeasible. The library is a significant part of our education system for the whole population and can be argued to be the most accessible form for everyone. I speak not only for myself. Naomi, a supporter here with us, represents the estimated 130 homeschooling families in Invercargill who rely on regular access to the library for educational needs. At an average of 4 children per family, this is 520 children who need access. They do not have the support of a school behind them, and without the resources supplied by the library, their children's education will suffer. Homeschool children over age 12 who are vaccinated are also included in all mandates and will be excluded from essential educational activities. Homeschoolers have already felt the loss of the library's regular groups and clubs, which they attended every week, that were stopped due to COVID restrictions. They have lost access to the stadium, playgroups and indoor venues that they hide during winter weather. If they do not have the library and the pool, they will not have anywhere. What's more, it is the right necessity of every New Zealand child and adult to learn to swim. In a country surrounded by beaches and traversed by rivers, it is imperative that its citizens are safe in and around water. The average yearly fatal drowning rate for New Zealand is 81 lives lost per year. Not included is the many near misses that have lasting effects. If the swimming pool is mandated, many children will be excluded from entry simply because their parents are unvaccinated. They will be disadvantaged and put at risk because of the passport policy. Adults included. Many adults, particularly immigrants and former refugees who I have personally worked with, are adult swim learners and would be put at risk if excluded. Consider also other beneficial effects of exercise and socialisation that would be lost. Jaron, another supporter here, is a working dad who is vaccinated, but he is very concerned and shocked at the proposed levels of segregation and how that will impact our society. He is personally not affected, but is saddened for those that are and what that means for the well-being of individuals. He is not the only fully vaccinated person I've spoken with who shares the same sentiments. Many think this way. Peter, another supporter here, wishes to express that such discrimination is unjust and penalises people who have the right to choose their healthcare treatment as per the New Zealand Bill of Rights, Section 10 and 11. 6 days ago, Invercargill City Council posted a Facebook post outlining the restrictions under the new protection framework. 99% of comments of the post are in favour of your decision to keep public facilities such as the library and pool open. Other councils in New Zealand are keeping public facilities open to all. To change your policy now would be against the clear wishes of the community. People can see that while we need to care for one another and keep each other safe, it cannot be at the expense of a significant group of society, and that division would occur. COVID-19 and the government response to it have impacted people in different ways, often amplifying existing structural inequalities in income and poverty, socio-economic inequalities in education and skills, and intergenerational inequalities, with particular effects on families with children, young people, and the elderly. It has impacted relationships, social development, and mental health. The pandemic itself has exacerbated existing inequalities and differences. Let us not create new ones. I understand the impact that COVID will have on the health of individuals and the healthcare system. I wish for no one to suffer and endorse effective public health measures to limit COVID spread, but let us not cause unnecessary suffering in other areas. It is important that you consider responsibility for all aspects of health and well-being, not only one narrow sliver. We must think holistically. In this time, it is important to not lose sight of our humanity, our empathy, and love for one another. Forcing segregation onto individuals when it is not justified and doesn't improve safety outcomes only enforces the fracturing of society and encourages divisive attitudes. We must ensure that in all things we protect and uphold the dignity of all people. COVID health crisis will not be with us forever, but the attitudes that we encourage now may never be eliminated from the fabric of society. Morals, ethics, and principles are most important in a time of crisis. That is when we must hold fast to them and allow them to steer our decisions. They exist for the crisis when our thinking is coloured by fear. Discrimination is unethical. Let our city be brave and keep a long-term view of things. We must foster love and inclusion even in a time of fear in order to emerge from this as unmarred a community as possible. The cure cannot be worse than the problem. In our community, it is important that there is always a place where all are welcome, where all can enter regardless of disability, status, income, and personal choices. Nothing strips a person of their worth. If you choose to mandate for passes only, a significant portion of our community will be unfairly discriminated against and left with no space where they are welcome. Your facilities are the only community spaces left. To change this is unacceptable in a democracy in a nation such as New Zealand that cares for all of its citizens equally. Vaccine passports only in a public facility will do more social harm than good. A safe community actively protects against discrimination. Please, protect public health and maintain safety from infection, but do so in a way that empowers, respects, and includes all people. Thank you.
Thank you. Before I go to the two people that indicated questions, I think it's important that I point out that this is not about reversing decisions. Today is actually the first day we are making one. Okay, so governance haven't had a chance to make a decision prior to today. Councillors, in your questions, they need to be questions. I'm not interested in engaging in debate with our submitters at this point. So, Councillor Lewis was first, then Councillor Clark.
Thank you, Chair. Thank you very much for that.
And Councillor Soper. Thank you, Leslie.
Thank you very much for both of you, your comments. I wish we had more time to ask lots and lots and lots of questions, because so many of these issues have been raised in public media and by various professionals with whom I've got contact. Perhaps I'll just ask one particular question. What do you think of the Paxlovid new Pfizer drug that's been trialled?
I actually honestly don't know much about it. I do know that ivermectin is probably one of the safest drugs in the world, has over 4 billion doses been given, no one's died of it, and there's over 62 randomised controlled trials showing that overall it's useful. So personally, I feel really comfortable using ivermectin. I know that that's received a lot of bad media press though, but I sometimes think you have to follow the money and realise why has that been gone like that. So honestly, don't know about the new drug. I hope it works, but again, I guess I like to see longer term safety trials with things. And so I'd probably still be somewhat hesitant. Yeah.
The ivermectin is an interesting one because we don't have tapeworm in New Zealand anymore.
That's not a question, Councillor.
Do we?
Councillor.
Yes, thank you.
Lewis.
Do you know the
Councillor Lewis. Thank you. I'm chairing the meeting. That's you're getting into a debate, not.
I wanted to ask if they knew the cost.
Can we get to the question quickly?
No, that'd be fine then.
Thank you.
Thank you very much.
Sorry, Councillor Clark.
Yeah, for Sophie, just 3 questions, very quick ones. The Director General of Health has said that to us that, or to the New Zealand community, that non-vaxxed people spread the virus at a quicker rate than those that are vaxxed. Would you like to comment on that?
I would dearly love to see the studies that he gets that from, because I've been an expert witness for the High Court case for the border workers. I've looked at this very, very in depth with Simon Thornley, who's also worked with international doctors, Peter McCulloch and Byron Bridle, a top vaccinologist, and we see no evidence that they pass it on at a higher rate at all. I think there might be a confusion there when they say this 10 times thing. At the moment, if you look at the numbers, so every week I'm calculating the Auckland numbers, and they are showing, the vaccinated are showing symptomatic COVID-19 disease at a higher rate than vaccinated people. And that's what it's meant to do. It's meant to make you less symptomatic. But we don't actually know what the levels of asymptomatic infection are. And in the Pfizer trials, there was no testing for asymptomatic infection. Those with asymptomatic infections have exactly the same viral load, whether they're vaccinated or unvaccinated. So, and with that household transmission study that I've got here for you, households, they're the places where you pass the virus on the most. Yep. And there was no change in transmission. So I just don't know where Dr. Bloomfield gets that from, but I'd be interested to see.
Sure. Just another question in relation to Dr. Bloomfield then. On the media recently, he said that the non-vax population will be around about 10% at this stage. And he also said that 40% plus of the hospital admissions were people non-vaxxed. So you would like to help me with that?
So I've done the calculations on that as well. It's maybe about 50-50 or something like that. So yeah, definitely it does. The vaccine certainly produces self-protection for about the first 3 months. So you get your first vaccine, doesn't do much, get your second one. You're actually really risky for the first 2 weeks after your second vaccine, and you're more likely to get all sorts of infections. But then after that, you've got like a 3-month golden period where you have pretty good protection for yourself against getting severer disease that then wanes. So definitely, yeah, of course, there are less hospital admissions. But in time, that certainly does wane. And if you look at the Israel numbers now, it's not doing much at all.
Just a final question. You made some reflection on some anti-vax people feel that they've got worsening cancer situations because of the vaccines.
Yeah.
And I just would like some guidance on that, because a lot of people that are in that health compromised area are actually encouraged to have the vaccine because they are compromised.
Yeah, it's really tricky because in the Pfizer's own documents and the data sheet and in the MedSafe risk assessment, it talks about the different studies that have not been carried out. So personally, in some of my own patients with blood cancer, and this is one that I could observe, because you can see blood cancers changing quickly. You can't do this with other cancers. And I had 2 of my own patients, the blood cancers got, quite a lot worse in the couple of months after the vaccine. And then they started settling again, which was great. Now, I don't know what the studies are. There have been other international doctors who have mentioned that they have seen increases in endometrial cancer. But it's an area that we just don't know the answers to, like so many areas. So it's
okay.
Hard to know.
Thank you.
Thank you. Councillor Soper.
Thanks, Mr. Chair. I just wanted to ask either or both of the submitters what their reply would be to those vulnerable, immunocompromised people who will feel that they are unable to use library pools, Hei Wakaturia, etc., if the unvaccinated can.
Yeah. Look, I think that I really feel for those people. Both of my parents are over 70 and have medical conditions, so I understand. I think they need to know that they're not safe going to if there's areas of high transmission, regardless of whether the people there are vaccinated or not, they're still not safe. Looking at the numbers in Auckland, you have just as many vaccinated people with COVID as you have unvaccinated people with COVID. So, and as the Ministry of Health said, when you've got high vaccination rates, you're more likely to get it from a vaccinated person. The other thing is, if a vaccinated person is more likely to be asymptomatic because the vaccine has reduced their symptoms, then actually, are they more of a risk? Because if an unvaccinated person gets it and gets lots of symptoms and feels like rubbish and stays home taking vitamin C, they're not going to spread it. If a vaccinated person gets it and has hardly any symptoms and feels tickety-boo, they're going to be walking around with just as high viral load and able to speak it, sing it, all that kind of stuff. So I think for the vulnerable people, and when transmission is high, when we're actually in red, then they will want to probably be isolating themselves anyway. I'd also encourage them to be getting their vitamin D levels up, something our country is not talking about enough, but is incredibly useful. So there's many, many things they can do. But I think that whether unvaccinated people are excluded or not isn't going to make much of a difference. Does that answer your question?
Nikki, did you have a comment?
Yeah. I would just like to comment that actually I'm in that vulnerable group. I'm extremely vulnerable to COVID. I've spent a lot of time in intensive care with respiratory disease. I also have autoimmune disease. That is me. And I have to, my risk from COVID is more than just from the library. It's going to be everywhere. It's, I need to take responsibility for myself and decide for me what level of risk I'm willing to accept and do that wherever I go, because it's not just libraries and pools. I mean, kids are in school and mixing, there's churches, there's other community places, there's the supermarket, there's everywhere. It's not just these places, and everyone should be taking personal responsibility.
I'd also say that they would probably want to get themselves an N95 mask. So the spread of the virus seems to be largely through aerosols, and the little cloth masks we put on don't do much at all. As a doctor, I have caught a cold through a mask, and the patient, we were both masked, the patient and I caught a cold. So at that moment, my faith in those little blue masks went severely down. But I do have a lot of faith in the N95 mask. So I think for the vulnerable, being able to get a well-fitted N95 mask is their absolute best form of protection, probably, getting their vitamin D levels up and thinking about some of those other preventers that we've talked about.
Ms Cook.
So as a double vaxxed immunocompromised person over the age of 70, what is your advice to me? Stay home?
No, I'd say enjoy life. You don't want to hide away for the rest of your life because COVID's here to stay. I would say get your vitamin D levels up, get your vitamin D levels tested because you want them over 70. Take vitamin D, and once it's in the community, I'd be saying take zinc and vitamin C and an extra nutrient called quercetin, which gets the zinc into your cells. And when you've got those things, your risk drops dramatically. And then when you catch COVID, which you may well still do as your immunity wanes, get in touch with me and I'll give you all the other stuff.
Councillor Pottinger.
Thank you. Look, it was fascinating what you said about the transmission rate between a vaxxed and an unvaxxed person. Now, in your opinion, without the government painting the picture of the unvaxxed being the unclean and a scourge of society, would this whole traffic light system and passport system have any substance? If you took away that portrayal of the unvaxxed being a problem, would any of this mandating have any substance?
I don't think it would have any substance. I think it makes no scientific sense to me at all. And the world, looking at the world, it's managed the pandemic, managed waves 1, 2, and 3 of the pandemic over the last 18 months or whatever. And a lot of that they went through without vaccines. And they managed with early treatments. There's a Dr. Shankara Chetty who works in South Africa, and he's worked out how to treat COVID through his own patients, and he's treated 7,000 patients and not one has been admitted to hospital. So the rest of the world has done a wonderful job with it, and in New Zealand we've watched them and we're terrified because we've been kind of safe and we're watching it come towards us like a tsunami and we're just so scared. Yeah, I don't think that answers your question, does it? But I think you're right.
No, you did.
It's an interesting portrayal of the unvaccinated. And personally, as an unvaccinated person, it's horrible to feel the look on people's faces when they realise you're unvaccinated. You feel horrible. It makes you want to cry when you realise that they look at you like a lesser person and like a disgusting kind of person.
No, thank you for that. Appreciate it.
Thank you. Thank you, councillors. Look, thanks, Sophie. Thank you, Nikki. For coming along and presenting today. We appreciate it, and the questions that you've been able to answer for the councillors as well.
I'll leave these papers on the table.
Thank you.
Right?
Councillors, as a matter of process, our first step is actually to receive the paper, the COVID Protection Framework and Vaccine Passports for Council Services and Facilities paper as a major late item, and I will so move. If there's a seconder, Councillor Amundsen, thank you. Any discussion? If not, I'll put the motion. All in favour?
Aye.
Against? Carried. For a start, before I give councillors the chance to have their say, make their statements, I will ask the Chief Executive to introduce the report and also acknowledge the presence of the Executive Leadership Team. Thank you for your input thus far and your presence this afternoon. Claire.
Thank you, Mr. Chair. Look, I want to remind all councillors of the need to bring an open mind to the discussion. In terms of predetermination, it is important that you don't, that you put those aside, the thoughts that you may have had. There have been some comments in the media. I can't comment on social media, but the need is for you to come here today with an open mind. This issue before you is not about staff. This is about public access. It's not about staff access. And the report is going to be presented to you by Executive Leadership Team, all of whom are double vaxxed. Mr. Gibbling happens to be out of town, and that's a pity, but he has a very able man in his stead, Mr. McQuarrie, who will be able to assist. And I'm sure that between all of us, we will be able to answer all of your questions. I'll hand over to Andrew, who I think has got a little presentation to put it in the right context.
So, do you want to pull that mic in, Andrew, please?
Am I talking? You got to walk it. I don't talk the best at times. I think it's important to start the consideration of this by really drawing back to the fundamentals, I suppose, of what we're considering and recognising our limitations, I suppose, is the real point. None of us are medical experts, and you have a look at this in all the government guidance, and even when it talks about it in the sense of a from a workplace health and safety perspective, it recognises that and says, look, none of us are experts on this. As much as we all sit on the couch and think we might be, we're actually not. And so we need to take lead from people who have access to that expertise and have made decisions based on a lot of advice that ourselves as a council would struggle to, one, be able to organise, and two, to be fair to everyone here, including myself, would struggle to actually be able to interpret and apply appropriately. And it's in that sort of context that you look at the guidance that has been given to councils and the community through the traffic light system. And so it's important because everyone talks about it and everyone talks about the fact that they don't understand it, but it's important that we almost go back to that as our starting point, because really what the decision that is really being asked of council today is, do we follow the guidance in the traffic light system that's been given by the government, or do we for some reason divert from that guidance because we think we know better than what they're telling us? And that really is a crucial part of this discussion that you need to understand, because at the moment the guidance that we have put out and that was referred to early on from the presenters is following the guidance that we've been given by the government. So we're going to talk through, have a look at that guidance, make sure everyone understands it, and then just by way of background, and then have a look at specifically what that will mean for our different facilities, what it means if we operate under that guidance, if we want to vary from that guidance, the implications for effectively the levels of service that we can provide to the community. So that's the sort of background that I'm trying to give by this sort of going through this process. I'm just trying to get back. I don't think that's at the beginning. Yeah, so effectively what we're talking about is the COVID protection framework. Everyone refers to it as the traffic lights, so I will. I apologise that what I printed out is black and white, so it doesn't really look like traffic lights, but it's there. The reason why the government brought in the traffic light or the COVID protection framework was for two reasons: to minimise the impact on the community and provide protection to the community. And in reaching that decision, and you'll see there's a little bit more commentary around it in the paper around the first and second reading speech, but it's important that you recognise that in coming to those positions, the government took health advice, took legal advice around the Bill of Rights. It took into account a whole heap of other factors and a broad range of factors when reaching this position as to where it's trying to position the community and the country for living with COVID as an endemic disease. I mean, and that's really the starting point. So the government has considered, when setting these levels, the protection and the rights that everyone should have, taking into account a whole range of factors. And we can only sort of guess what they are, and I think I make the note in the paper, or it might have fallen out. It's disappointing that the government won't release that until January. But when that is released, there will be a lot of information that goes into this and that has made it up and that supports the reasons why they believe the settings that are given to the community are the best to minimise and protect. And that's really where we're starting from. Just picking up Claire's point, the workplace health and safety, again, it's important that you distinguish these two things. And you'll see, you would have read in the press, a lot of councils are coming out saying, oh, we're going to mandate this, mandate that. And then they'll come out a day later or an afternoon later and say, oh, but we still haven't made a decision on staff. Because they really are two separate decisions. To a certain extent, they may overlap in that if you are, for an example, in an event, providing an event, and you have workers in the event, then they will be required to be vaccinated, they'll be required to wear masks. They're controls that are implied that we might have in a council situation but would not be mandated, but for an event they're mandated. So to a certain extent it doesn't override the workplace health and safety assessment, but forces you as an employer to imply certain controls around your workplace health and safety. Does that make sense? But other than that overlap where they might address the same things, they are different assessments that can be made independently and are made independently. And so we've gone through the process from a workplace health and safety perspective and assessed the risk to staff, but that is not really impacted. Well, it's not impacted by this process here. So the other key thing, and it really is crucial, that really what drives the whole process is determining what you are. Under the traffic light system, what are you? Now, this is a list of the ones that apply to areas that we are involved in, but our starting point for everything is that we're a public facility. And we'll go through and have a look at what that means under the traffic light system, but everything else underneath that is really almost like a subset. In some circumstances, we will say we have a public facility that is primarily used for events, therefore it makes sense that we actually treat it as an event space. But our starting point for all our facilities would be that they're a public facility. There was a bit of debate, because I know it'll be a topical one, but there was a bit of debate about how swimming pools were treated, but the clear guidance had come down that swimming pools are public facilities. Now, obviously, if someone wants to lease the swimming pool to have an event or a gathering, then the event or gathering rules would apply to that. But for the majority of its operation, the swimming pool is a public facility. And again, I'll put it up there and I'll repeat it every time. The government, in setting the rules, was setting those to minimise and protect the community. So the rules that they set were the baseline that they think are appropriate to minimise and protect the community. Just repeating what I said earlier, once you've determined the activity, the rules around how you can operate under that just flow. It's pretty easy. I mean, if we're a public facility, then it's pretty easy. It only becomes complicated where you've got hybrid sites. So if you, I mean, the classic one they use is obviously you've got a library that has a cafe in it. Then you've got different sites. If you can't separate those different sites, then realistically you've got to take the highest level of controls. So in that case, you'd have to use it as treat it as a cafe, or you close the cafe. So you've got to try and manage and make a call within them where you've got these merged sites. But for us, again, we actually don't have that many where a merged site causes us a problem. The other one to bear in mind is you cannot game the system. I mean, so for instance, it's interesting, and people will talk about later in the event of the impact on the facilities. For us, you might look at it and say, look, if we say that the pool's an event, we can have more people at the pool than we can as a public facility. The short answer is you can't. No matter what we say in terms of requirement for vaccine passes, whatever else we do at the pool, it will always be a public facility. The capacity will be limited by the settings for a public facility. And you saw that, I don't know whether anyone did, but there was a cafe, I can't remember where it was up north somewhere, that tried to do that. They said, oh no, we're not a cafe, we're an event. And funnily enough, the government came out and said, no, you're not, you're a cafe. You're an event if you leased it out to an independent party, but as long as the owner is operating the facility, you're a cafe. And so it's common sense. You can't play it. The rules, once you get your head down them, are fairly clear, but you're stuck with what you get. So the only option we have, and it comes out, and if you have a look on the traffic lights, it's mentioned every time under the public facilities, not in the one that I printed out for you, but in the detailed one. Council has the option to still determine that it might want to use a vaccine pass at those facilities. It's not mandatory, it's not compulsory, it doesn't change any of the other settings in terms of how many people can be at the venue or what else we have to do, but it specifically calls out that public facilities can determine to do that, as anyone can. It's hard to explain to people. It's just an additional control. It's like if we said only people over 18 can come into the council chambers. I mean, it's just us setting rules for how we can operate our business. It has consequences for the level of service that we provide to people and how we provide that service, which will be explained a bit later on, but it's a decision that council can make. But again, I'm coming back to this point. The core point is, on what basis are we making it and what are we trying to achieve? because the traffic lights are aimed to minimise and protect. So what do we think we're trying to achieve by doing something beyond what the government sets as necessary to achieve those outcomes? The other thing that really is, and it comes through very clearly in the traffic lights, is that public facilities are treated very differently. It's clear that basically, other than green, public facilities operate exactly the same at orange or red, whether they use a vaccine passport or whether they don't. And so, I mean, you sort of think to yourself, why? When you look at the business operations, they had a Hobson's choice. I mean, they could operate with or without a passport, but the reality is, to operate, you had to have a passport. Now, so that drove a behaviour for events and gatherings. They had to go down this path. Yet, clearly, there's been a conscious decision by the government in the background. We're not going to force public facilities to go down this path. In actual fact, we're not even going to make it any better for them if they do. We want them to be open and operating, but in operating at levels that we have determined that minimise and protect the community. And they've made that decision very clearly and set it out in what they've done. As I said, there's a lot in the way this is presented that is driving behaviours, but you need to have a look and look through it clearly and see what questions it's sort of asking around those behaviours. There's also a third subset, obviously, and that will apply to some of our facilities, potentially. The government's flagged that things like emergency housing will not be able to ask for vaccine passports. So there are certain things, certain core public sector provision of services where the government is still trying to finalise its position around saying you actually can't ask for a vaccine passport. Oops. Looks like we've got to the end. So I think probably easiest now, I mean, I'm happy to answer any questions if you want, but I suppose I'll get back to where I started. It's important that we understand what we can make a decision on and what we are in a position to realistically make a decision on. If we wanted some more advice on things, then we can, but there has been a lot of advice received by the government informing these settings. If we wanted to change our settings because we thought there was a health reason why we should, I would probably urge on the caution of saying we'll go and get some health advice around it, because I don't know that despite the amount of information that we've all absorbed on COVID, that we're actually in a position to make those calls. We can all look at the settings and say, it's not what I do, or I don't see how that makes sense, but that doesn't make me any better to make the decision than anyone else. And so if you just want to go through some of the specific impacts on the facilities. Oh, sorry.
So, councillors, if you can hold off on your questions at the moment, we'll go through each of the facilities. Then I'll give you a chance to ask questions, bearing in mind that they will be questions. We'll save the points that you'd like to make till later. And we'll do that after each facility. Is everybody comfortable with that? Right.
Do we need to?
Councillor Clark.
No, I'm not comfortable with that. Just a couple of things that Andrew raised that I think are pertinent to what we're about to decide. So,
we're not about to decide anything. We haven't finished listening yet.
Okay.
So, Richard, I think you've got the magic talking stick.
Kia ora koutou, everyone. I just want to reiterate that no matter what the decision or the outcome is of today, no matter what level of the framework we're in, or alert setting wise, or no matter whether we ask for vaccine or vaccine not, we are and have always had the public interest and health and safety protocols in place at the forefront of our minds. So we will continue to abide by the regulations, but also ensure that we are doing all those other things like good masks, good communications, all of those things. So no matter what the outcome is, we are operating safely within the guidelines that we've got. For the purposes of this, we have focused specifically on the operational requirements of the business. So we're not taking in those wider things that you're going to look at later on in your debate. We are looking at what does it mean for the business to open day to day and the sort of constraints under these different levels, under the different scenarios. So we'll start with Splash Palace, and typically the same as with all of our public facilities, the capacity limits do not change from level to level, vaccination or unvaccinated, in the general principle of allowing people inside the building. Okay, so apart from the Civic, which is, as we've already talked about, in the event space, so the Splash Palace remains at the 1,000 cap for people going through that door and able to use that service, no matter where they are, no matter what vaccination certificate they're using. The difference comes purely in the event space. If they are holding events or they have a third-party activity happening on the site that may require vaccination certificate or limits on numbers, depending on whether it's classed as an event or whether it's an external hire privately, etc. The other impact, of course, is on the cafe, but of course that's a supplementary service, not core business of the Splash Palace. That's Splash Palace. Do we want to stop after each one?
Yes.
Yeah.
Any questions around Splash Palace?
So I guess the logic says then that Splash Palace Cafe is either closed or requires passports. Can you tell me which it is at the present time? It's closed.
Through you, Mr. Chair, it's actually running a contactless service at the moment. So right through, we can do contactless if we need to, and that kicks in at the orange level. So without a vaccine pass checking, it is a contactless service.
Thank you. I guess, no, what I was going to say is not a question, so I'll break myself. Any other questions around Splash Palace? Councillor Clark.
Just a confirmation. I think I picked up a comment before that all the staff at Splash Palace are double vaxxed.
Councillor Clark, or Mr. Chair, my comment would be that this is not an opportunity to ask the vaccination status of staff by group. The paper reports that we have identified those roles where staff need to be double vaxxed from a health and safety perspective, where our assessment is that there is a risk that needs to be mitigated using the questions that are provided by Workplace Health and Safety. That's as far as it would be appropriate.
I'll accept that as an explanation. Beyond that is operational.
Yep.
Okay. Mrs. Coote.
That's fast.
I did read the document, and even though it said that there was no limit on how many people can be inside a public type facility with capacity limits based on 1 metre distancing, does that apply within the pool as well?
Through Mr. Chair, indeed it does. Now this is some of the ambiguity that is across the different settings for the different types of businesses. And I know, particularly from our clients, everyone wants to know what happens tomorrow and what is the answer. And we're all sort of, tensely trying to answer that. We are living in an evolving situation, an environment that's iterative. Our response is iterative as well. There are, when you look closely, some anomalies across the different types and classifications, and we've acknowledged that. And I think that'll get tighter as time goes on. But the calculation is based on the square meterage of the building. And of those spaces available to public. And when you look at Splash Palace, actually it is a big building with a lot of square meterage, and that equals actually more than what the fire capacity limit is. So some of our capacity at 1,000 for Splash Palace is actually the same as the fire rating, so it has no material difference of access.
Because that also applies to libraries and
correct. So
centres and the whole lot. So.
Yeah, so libraries stay at 413 all the way through.
Councillor Lush.
Andrew, just explain to me why in another around the country, a lot of the pools and libraries are making it mandatory for vaccination. Is that a different application that they've done, or a subtlety, or what's the discrepancy between councils?
Well, through Mr. Chair, I think the purpose of local government is to apply a local or regional lens to a solution rather than a central mandate. So the choice has been given, and I think it's up to each individual community to respond in a way that best meets the needs of the community members. So I don't think it's a misinterpretation or a change in interpretation. It is simply a choice that's been given to the local authorities to make. Also acknowledging that, Auckland, for example, is coming out of red, and so their body of knowledge that they are holding on their shoulders is quite different to what we may have down here.
Councillor Soper.
Thanks, Mr. Chair. Just going back to the question about the Splash Palace Cafe, could you just finish the thought there. So at present, with no use of the vaccine pass, it's a contactless service. Use of the vaccine pass then means for the cafe?
Through you, Mr. Chair, yes. So if they at orange level, if they instituted a vaccine certificate verification, they will be able to have a seated and served cafe. So again, still scanning in, seated, they can't wander around with their food, you can't have buffets and things like that, but seated and service can operate at orange level.
Thank you.
Councillor Skelt.
Thank you, through you, Chair. Richard, just a couple of questions. First one, the best business practice decision for the operation of Splash Palace would be under the traffic light system as we have it would be what?
We are comfortable with the settings as they are in terms of being operationally implementable. It's following guidance and it's working to date. There are no major concerns as is.
Second question, the best health and safety decision for the community given the government's guidelines, given by the Ministry of Health, would be how would we operate? What would be the best way to operate?
Through Mr. Chair, I don't think there is a golden answer in this. If there was a golden answer that we knew was the right thing to do, it would probably be mandated. So we've been given a choice based on either options here are safe, are able to be implemented. It is our choice and our role, of course, and your role is to represent the community views on that. We're not scared by either version, I think is the key thing.
So are you saying as the group, as in consensus, the best way to operate, given those two scenarios I've given you, would be to have everyone double vaccinated? Is that what you're saying?
No, I wasn't going that far. I was saying we're comfortable with our position as is, and we will be equally comfortable if the elected members chose to use vaccination certificate.
Thank you.
Councillor Cricket.
Thank you, Councillor Ludlow.
Hello, is that working?
Yes.
Okay, good. I think we've been really blessed that we haven't had COVID and Delta rip through the community like we have.
We're getting to a question, aren't we?
We are getting to a question.
Can we do so quickly?
Our country, yep. Okay. You've now railroaded me. Now I've lost my question. Now I'm gonna have to come back. Sorry.
Okay. Well, it's a good idea to start with it. Any other questions around Splash Palace? I'll let you come back to it when you remember. What's the next facility then?
Next facility we're going to look at is the Eve Paul Library, the public library. All of what I've just described in terms of those level and changes, very similar to the libraries. So libraries maintain their maximum capacity limits. Again, the biggest thing is that if things get classed as events, so the events and programs are acknowledged to go under that separate definition and may be more restrictive, or will be more restrictive rather, as we move up those alert levels. So specifically, those are community programs. The great thing with the library at the moment is and I've forgotten the name of it, but the click and collect version of library books is in place, and there is more and more e-resources being made each year. So it's beyond just the facility and the wall. So we are lucky to have that ability to have an online presence, a remote presence, as well as the facility itself. Invite any questions?
One of the issues with the library is a large number of entrances. If there was an introduction of vaccine certificates, how would we cope with, I think, 4 entries?
3 public entries and 1 service entry that's used and open for particular events. This goes across all of our facilities. Implementation of a vaccine certificate, the verification service, will have an impact on, and it'll be discussed a little bit later in finance, but will have an impact on staffing levels, the types of staff that we employ and ask to do that job, and where they're situated. With the library, we've got a very clear D Street entrance, which is very visible, open, and sightline of the front counter, but also 2 entrances off the car park that are a little bit out of the way, that are a far more confined space. So if there is an altercation or any sort of education conversation that gets heated, it's a little bit enclosed and further, and might require us to look at resource such as security rather than staffing it with regular staff. So yes, in across all of our facilities, verification does come with added investment in IT as well as a workforce implication.
Councillor Amundsen.
Thanks. The submitter before mentioned that some of the activities and stuff have not been operating in the library, and I notice in the list of things on page 7 around if vaccine certificates are not used, that events and programs and gatherings would likely be affected, but there's nothing, I guess, to in the if vaccine certificates are used, would those things come back?
Through you, Mr. Chair, I think that's the million-dollar question that all of us are asking ourselves. We're trying to compare the future with what was normal, and to a certain extent, we have to release what was normal because there may not be that benchmark able to be, when are we going to recover? We don't know. There's still hesitancy about coming back. We've probably been quite cautious about the programs that we do offer because we're trying to find our space and how we're going to operate in this new world. I'll invite Mary Ann to answer the question about programs if I possibly could.
She's just going to come and grab that microphone.
Mr. Chair, we are trialling some remote programs as well, so we are continuing with our programs. A lot of those are done as an outreach, and we're also providing some programs where families can work in a bubble, come and partake of the program in a bubble, and also take craft type things away with them to do that time.
So just to clarify, the loss of those programs that's been mentioned by the submitter is not a result of the traffic light system. It's been like that since COVID began.
Councillor Clark, then Councillor Scott.
Yeah, Richard, just on the issue of the multiple entry points, is it possible to restrict the 2 off car park security entryways?
Through you, Mr. Chair, I think yes. Whatever facility we want, there are barriers to accessing our facilities, and one of the barriers is car parking. So to block that off does actually restrict a lot of usage and becomes another barrier about why people might visit a facility. So certainly our aim would be and our desire would be to keep all the entrances open. I also want to acknowledge at this point in time that we are not quite sure what the next 6 months hold in terms of technology solutions. So at the moment we're taking if we go down vaccine certificate verification, it'll start with just simply citing, it will move to phones, but in 6 months time there might be other alternative technology. And one of the things we've seen in the United States is the higher use of turnstile facilities where you can step back from that person and still see a green light, etc. So we will have to wait till the market catches up with that. But our principal thing would be to keep as many access points to the library open as possible.
So just one question to follow up to that. I had a look at those 2 off car parks today. Is it possible that that could be reduced down to 1? Now, a way to do that could be that it's exit only. So you turn off the sensor on the outside of the door, so nobody can come in on the second floor, which is quite an isolated area. But they could come in on the ground floor of the car park, be directed down and come in. But exit-wise, for fire service, they could still go out.
Through you, Mr. Chair, certainly with whatever gets decided here today, we will work through the operational requirements. We don't want to get bogged down today about those things at a management level, but we're happy to try things. We're happy to be iterative with our response and live in this ambiguous world for a little bit while. So yeah, we would quite happily trial things as appropriate.
Thank you.
Councillor Cricket.
Thank you. Now I am going to get question out, and I'm not expressing an opinion, so please, Mr. Chair, do entertain my dribble. When our people in our community become sick, because I guess it's a little bit of a degree, I feel, of complacency at the moment with us not having it here and for such a long time, do we have the ability at any point to change our mind if the risk profile increases? So, or could we take a staged approach to when we implement a mandated vaccine pass? At X point, we could decide a break point of when the risk to the community is too great.
Through Mr. Chair, I think that's a really good point. Remember, the traffic light system allows for an increase in a change of operation environment, and that's why we would naturally move up from a green to an amber to a red. So it's got that built in, but at any stage, if we felt that we were out of step with the community views, or we felt that the risk profile had specifically changed within this environment, of course, I think we would want to be able to have a conversation again. So we're not asking for an all in eternity solution here. We have to acknowledge that there will always be iterative response.
Okay, just so everybody's up to speed with my question list, I'll be going to Councillor Skelt, then Mrs. Cooch, then Councillor Pottinger.
Thank you, through you, Chair. Just two questions, Richard. Just the demographic of the most used, the user of the facility of the library at this present point in time would be age group wise?
Through you, Mr. Chair, if I answered that, it would be purely my speculation and personal opinion. I think I'll refer to Marianne.
Marianne, do you want to take your best guess?
Young families and older, over 60s.
And could you give me a split on what would be the greater of the two?
They're probably about equal, I would say.
And perhaps to either of the group, could you give me an opinion on who may be then medically the most vulnerable?
I don't think they
of that
can.
group.
Because
We have some medical experts with us.
No, it varies from person to person. Every individual is so I'm saying no to the question. Sorry. I don't think anybody here has an ability to answer that. Andrew, have you a comment?
Yeah, my only comment would be that inherent in the system that we've been presented with is those calculations. If we're going to make, if there was a need to make rules for parts of the demographic, then the system we were presented with would have that inbuilt. The fact that it doesn't, inherently they've taken that into consideration. We could go down that path, and that's what I'm saying. If you wanted to go down and have a look at those sort of points for your decision making, you would have to get some specific advice on it. But those calculations are inherent in the model.
Thank you. That's where I was leading to. Cheers.
Thanks. Mrs. Coot.
I do understand that we may need to apply like different rules in different places, and my question is regards to the technology and the changes that may have to happen if we apply the My Vaccine Pass verification. It's quite interesting that we're a wee bit behind because cafes, bars and restaurants had to apply that straight off within like 24 hours. And I know many sort of just got a cheap phone, downloaded the app, and it's been used successfully. So, I mean, when we're considering cost and technology, I think there's no barrier there because it's doable. So that would be my sort of position with the.
Not looking for your position, Pania. I'm looking for your question.
Sorry. So my question would be.
You're really pushing the limit here.
If we are actually going to apply any My Vaccine Pass with any of our places that we're going to discuss today, what would be the timeframes around that?
Through Mr. Chair, in fact, we've already got one with events, and the Civic, of course, cannot operate practically without the My Vaccine Pass. So we are starting with just visual checks and then phones. The interesting things is the guidance from business.gov says that you must, if you're going to just cite them, that you must do random checks to verify, and it said that they'll come back with details about what that percentage is, and we're yet to understand that. And we know that there are some ticketing companies that are integration at the back end as well. So starting with citing, but that's actually probably quite good in terms of the iterative response and enforcement of government on are we doing the job right, and also allowing our community some opportunity to make mistakes and have conversations with them about how to improve. We know that supply is a bit of an issue for phones, but yes, we do have access to a limited stock of phones to be able to do that. And if the decision today was made to use vaccine certificates, we would be able to move on that in an appropriate time frame. We could make it work.
And so my other question would be, you know, because we need to provide a service for those that are not vaccinated in some way, form, you know, what would that look like, or what could that be like?
Through Mr. Chair, I think we know that the digital journey for our community has accelerated through the last couple of years in terms of online transactions and accessing online services, and to a certain extent that has caught a lot of parts of the world, you know, a little bit earlier than what we were hoping to have, and a little bit earlier than perhaps some of the technology available. We are always working towards going more online for our services and providing that democratic balance between online and in person. It just might mean that if we go down the vaccine certificate checking pathway, that we need to accelerate that and focus some more energy on that. Certainly the libraries have the ability to already do some outreach and some digital stuff, but that might change the profile about how we invest in our library stock. So we might look at more to build that asset base as well.
Thank you.
Councillor Arnold?
I need to be excused, Mr. Chairman.
Thanks. Councillor Pottinger?
Thank you. Look, this question is related to the question about whether a facility could change its status midstream. And my question is, and I know the chair's going to get angry with this, were you aware that yesterday Nelson changed its status from no passport to a passport when community cases became prevalent? Were you aware of that?
Would the chair like me to answer that?
Yeah, it's a closed question, so you can give one or two responses.
No.
Right, there we go. Then my answer that I was after.
Councillor Skelt, is it a question?
It is, sir. Richard, through your vast experience in the event industry, and I understand that you're running some events at Civic Theatre, are you, or is the public somewhat confused at the current state of where venues within the Invercargill are currently operating? Is there a level of tension, fear, intimidation, any of those factors, one or all, currently that we may like to consider in making a decision later on?
Through Mr. Chair, all of those traits are the characteristics of change. So I think yes would be to every single one, just the same as when we introduced compulsory helmets on bikes, seatbelt laws. Whatever change brings always brings a certain amount of anxiety and does settle down. My experience in the venue space, doing events in the weekend, a range of response. Interestingly enough, anecdotally, the older age group all presented their passes beautifully laminated from the warehouse and very well organised. And actually, the younger people were those struggling with having things ready and what they needed to do. So there is confusion, and I think that's where there is benefit in acknowledging that not only can we make a decision today, but we need to provide a little bit of space for communication and invest in those comm strategies so everyone knows what to expect prior to going to a facility, so they're not having that awkward conversation with the person at the door or the person at front counter. We do need to invest in our comms and clear messaging.
So the second part of the question was, in your vast experience and knowledge in the event industry, would it be, in your opinion, advantageous to be consistent across all the venues, that is the council and any other venues, so that our community can walk and talk and relate and interact with confidence?
Dancing along a fine line of conflict there, Councillor.
I'm asking, you can stop me by all means, but
I'm
I'm
about
asking
to.
someone who's very learned over there if you could give me a
I
response.
understand that.
Through Mr. Chair, it would be lovely if all of our decisions could be universally applied and understood by our community, and that will never happen. It will also never happen to assume that all community members are accessing the same facilities. Yes, there is an advantage in ensuring that we are in step with like facilities, so I do believe that there is an advantage of close libraries who have a reciprocal agreement with each other, that they are operating in a similar way, yes. For venues operating in similar spaces, it would be lovely to think that they were the same. But a blanket rule across all council facilities is probably not going to deliver the same message. There's still going to be nuances that will confuse people.
Thank you.
Thanks. Just with regards to the library and the question earlier about possibly closing off some of the access points, does that create a risk around the fire code?
Through you, Mr. Chair, or to you, Mr. Chair, rather. Whatever we did would be about restricting public access, fire egress, and would all have to still maintain. So there'd still be crash doors or whatever to get out, or be on a maglock system. We're simply talking about, do we check people at that particular door or entry point?
Thank you. Any other questions, councillors, around the library? Next on the conveyor belt.
Next, we've got He Wakatuia. This is an interesting one because we've got a very small space. So actually, again, capacity numbers don't materially change hugely between their fire occupancy levels and the restrictions placed on the different vax or no vax, different amber, green, red, etc. settings. The main difference here again is about our programs and our things when we are coming together. Now, the interesting thing with the He Wakatuia is school groups and external parties coming through will, of course, always have their own policy to adhere to, just like a private group or a retirement home, etc. So again, no material differences going through the different levels, apart from the need to implement a vaccine tech and checking facility. In He Wakatuia, that's quite easy because you've got one single entrance and you do have a reception right by that door as you go in. So it's an easier one to implement.
Sorry, Ms. Cook.
Through you, Mr. Chair. He Wakatuia is, whilst it is classified as a museum and art gallery space, it also is a private event space. So therefore, could it be that a hirer could exempt people from passes, even should we make it a vaccine pass facility?
Through you, Mr. Chair, you can have facilities that switch between the two. So that's what we're suggesting with the Scottish Hall, where it becomes the event organiser. There are, and of course with the Civic, we've got a vaccination clinic in the front. So obviously that can't be double vax because they'd be very quiet. But we do have an auditorium that requires double vaccination. We can't operate them at the same time, and we require an added level of shutdown and clean between those two modes. So it is feasible to run a facility with a double vax passport system and then have a private hire that they make the decision on, and provided there is space, it's not happening at the same time, and it has a reasonable and responsible level of cleaning between the two events.
A supplementary question to that. It's a space I know very well. Comes as no surprise to anybody here. I am concerned how small the space is, and the perhaps increased, or the perception of an increased risk factor for people sharing space with those that may potentially, taking the point that was made earlier, that we don't know who is carrying virus or not, but the extra risk that comes with such a small space.
Are we leading to a question, Evelyn?
Well, I wonder, Mr. Chair, what we should be thinking about in terms of He Wakatuia because of the size, and I wondered whether that was a risk factor that we were considering when we are looking at what we do at He Wakatuia.
Through you, Mr. Chair, certainly the traffic light system and the nuances between the different types of facilities do take into account air space and airflow. So that is a factor, which is why bigger buildings are, can have more people, and there's a different profile for outside events versus inside. If the decision was made and we were concerned at an operational level about the health and safety of that site, we would do a regular health and safety assessment, which may include looking at the HVAC systems. There are solutions in HVAC to install at cost, UV filters that do kill the circulation of air. So there are options out there. There are also freestanding options that we did a bit of investigation into. So if a decision was made, then we were then worried or concerned about that stuffiness or the airflow. There are some practical solutions that are available, expensive, but still potentially doable.
Thank you for your tolerance, Mr. Chair.
Councillor Amundsen.
Thanks. Just going back to the event side of things, I guess for He Wakatuia, I know that they haven't had any opening events for any of the exhibitions for ever. If we did or did not bring back vaccine or bring in vaccine certificates under orange or red, would they potentially be able to recommence?
Through Mr. Chair, that's a really interesting one, and I think this is one of the nuances that is going to be talked about in the coming months, because for those sorts of events that you might class as a cocktail function or where you go to a bar and you pick up a wine, technically, even using vaccine passes at orange upwards, it has to be a seated service. So you have to take your glass of wine and find somewhere quiet and sip it by yourself. That's probably not the experience that you're wanting for openings and or foyer space of shows, etc. So it might just mean a change in how openings are done, but regardless of the alert level or the vaccine or no vaccine, you're still able to have gatherings inside. So there's at the occupancy level, which is around 100, so that's still doable. It just might look different.
Mrs. Coote.
So just in regards to that, to my understanding, with those types of like nightclubs and gatherings and type things, that businesses can operate with number limits, but without number limits, but face coverings are also encouraged. So there is, I'm just saying, different rules of different things, and it's just quite interesting that you just responded that way.
And I think it's one of the things you've got to look at, because it's that point I was trying to make earlier. And if the event was being run by someone other than council, then it would be an event run under the event. But if it was an event being run by council, it would operate under the public facility rules. That's what I was saying in terms of gaming the system. That was what that cafe was trying to do. If we run an event, it's under the public facility rules. If someone else runs an event, so hence why the theatre works, because we don't actually, we lease the theatre to the party that's having the show there. But if we were doing it ourselves, then it would be under public facility rules.
Just supplementary to give some clarity on that one too. Because of the size of He Wakatuia, it's not a lot of difference. So if we look at the fire capacity at 118, it might be reduced down to an event that can only have 100, but that's probably not a material impact in terms of possibly there's only 60 to 70 people there on average anyway for an opening.
Councillor Lewis.
Thanks, Mike. It sounds pedantic. Civic Theatre, two separate entertainment areas, the room on the left and the auditorium. Two different events, or there would be a certain amount of commingling with the public toilet or the toilet facilities. How would that be dealt with?
Through Mr. Chair, they cannot run simultaneously. So there has to be a separation of time and airflow. We do have separation of airflow, but those commingling spaces, the toilets and the central concourse area, we cannot separate. As with everything, no matter what we choose, face coverings will be encouraged inside, and so it might be once people are seated they can take it off, but in those public spaces we will still be encouraging good measures about washing hands, keeping your distance and wearing a face mask, but we won't commingle the two types of events.
Thank you.
Anything else under He Wakatuia? Okay.
Next one we move on to is the cemetery and crematorium chapel and services. So we've excluded the open space of parks and reserves for obvious reasons. It's a lot simpler being outside, and it doesn't have controlled entrances. But here we're looking at a facility which is a public facility but used largely for private hires. So again, what we just talked about, like with Scottish Hall, it's the hirer who chooses. So in other words, you might have a funeral that the family decide they want to have unvaxxed and vaxxed people there. That would be their choice, and the hire is basically the funeral director, so they would limit it to 50. But equally, that family could say, actually, we want 100 people here, and we've checked, we're going to enforce, and we're going to be responsible for that enforcement and have it as a double vaxxed event. But again, that's on the event, not the venue itself. Just anecdotally, to give you a bit of insight, I had an inquiry from a woman who's having a wedding on the 18th of December, and she rang last week to see if we could accommodate them. And the reason was that they were all double vaxxed, but they'd booked into a venue that wasn't requiring double vaccine, and so therefore they had to limit a church. They had to limit their crowd, and so they were trying to find another solution very quickly for a wedding. And so no matter which way you go, there's going to be people that get disadvantaged.
Questions around chapels?
Crematorium, surely.
It's a really good microphone. Civic Admin Building.
I'll hand over to my colleague now.
Kia ora koutou. So, as you're probably aware, our Civic Administration building on the ground floor, we at reception, we offer a channel, a face-to-face service for customers. Mainly it's to take payments, whether that be rates or for dog registration or parking fines or infringements of other kinds. But also we offer advice and an inquiry service for people wanting to talk through something, or they might be wanting to lodge a rates rebate, or they may be wanting a request for service loaded in person rather than over the phone. We offer property file viewing as well, and often our staff are acting as receptionists for either coming to meetings in this space or to meet with other staff, so they might have a licensing interview, for example. So we have found since we returned at level 2 that already over 20% of the customers coming into our centre have not got a contact tracing app, so we're manually recording their details at the moment. The majority of customers using our face-to-face service do prefer that to phone or online, because they may struggle for various reasons, whether they have access to the technology or they struggle with hearing, or they just prefer to see someone in person. So we have put in extra measures to protect our staff and our customers, such as appropriate mask wearing. You'll find that you're concierged through our service, and we also have cleaning operating throughout the day, and that's been working really well. So if we were to make a decision on, or as you'll make a decision, if we were to go to a vaccination pass system, that would mean that we would need an extra triage point as you go through, but also it's getting our customers to embrace our online capabilities or our phone services if they're unable to enter the premises.
That obviously, how does that impact on people wanting to pay cash?
It's not, through you, Mr. Chair, it's not just cash, it's EFTPOS as well. So that does impact that they would need to work with their financial services provider to find a direct debit, direct credit, or online payment.
Questions around the Civic Administration Building ground floor? First floor and meeting rooms.
Staff are looking at me saying, gosh, who made the contribution in the report to this particular area? And I have to confess I did. Look, as you can see, it operates on the basis of 1 metre between elected members, between staff, limiting the number of people in the public gallery with 2 metre space between them. Again, it's your call. The point that's made in the report that it could disadvantage those without access to technology if they wish to participate, particularly as we go into an election year, if they wish to participate in the democratic process, particularly if the library also required vaccination certificates. Trudy's referred to the 20%, and this is where it starts to back up in terms of impact from one place to another.
Councillor Lush, then Councillor Kett.
If it came vaccine passport area, how would that affect councillors that were not vaccinated? Would they
would they just have to attend by Zoom?
There would be a choice for them to attend by Zoom. You have received legal advice from LGNZ. I'm going to start looking at Andrew, because actually this is where it gets really complex, in the sense that just because you require a vaccine certificate in an area does not mean that staff have to be double vaxxed in that area. And that is written in the legislation. That is...
Councillors aren't staff, are they?
Councillors aren't staff, and similarly we are unable to impose because in fact they are independent contractors. So I did have another look at the legal advice that was received earlier, but Andrew has the degree.
I think simplistically, it's something you can do, I suppose, is the first point, and it doesn't stop the councillor completing their duties by Zoom or otherwise, as long as, and I'll put the one rider on, as long as the legislation continues to allow that to occur, because that, particularly the Zoom meetings, was a COVID-19 adjustment, but presumably that will stay into the future.
Councillor Kidd.
Yeah, thank you, Chairman. Question number one, are all our elected members double vaxxed?
Don't think that relates to the issue.
Well, I think it does.
Well, I'm saying it doesn't.
Well, I want an answer, please.
Well, you're about to be very disappointed.
Well,
So I don't think under standing orders I can require anything, and that's my ruling. You can't require people to disclose that personal information.
why not?
Privacy Act.
There are matters of privacy, and we're actually discussing vaccination passports for buildings. So the vaccination status of councillors is actually irrelevant, and I'm not debating it further. I don't. Sorry?
No, because I have.
Well, I understand that you want to know, but as I said earlier on, you're about to be very disappointed. Because I'm not going to sit here and require all councillors to reveal their personal vaccination status.
Just ask them a simple question.
And I know, and I'm giving you a simple ruling as chair, that you can't ask that question.
I don't agree with you.
Well, I'm sorry, but you're not chairing the procedure. I understand that you want to ask it, but actually you don't have the right to.
Well, I've got very good reasons why I need an answer.
Well, there are many of us who have various concerns. Yes, Your Worship.
Point of order. I want a response to a point of order.
Yes, sorry, I want to hear your point of order, Your Worship. What was it? Sorry.
I think Councillor Keat is quite able to ask a question.
And what would your suggestion be if somebody didn't want to answer?
Well, that's their choice.
Yep. Councillor Clark?
Might be able to help with this. I approached this issue with the Privacy Commission about 6 weeks ago. He said an organisation can ask its staff, and be mindful this is councillors, so the issue will be who does the asking, can ask staff whether they are vaxxed. Staff have the right, as councillors do, to decline to comment. The organisation then has the right to assume that those people who decline to comment are non-vaxxed and treat them accordingly. So the issue is not, do we expose people at this meeting, which I wouldn't be in favour of because there are privacy issues, but somebody in our organisation at the governance level needs to go around individually and assess the status of each councillor.
So coming back to the point that I agree with your point, coming back to what I said earlier on, it's not actually relevant to the issue that we're discussing, which is the protection framework and vaccine passports for council services, which is why I've said no to the question. There will be another process that you can ask it through, but it's not this one today.
Can I speak?
Councillor Abbott.
I'm just want to say back to standing orders, if the chairman makes a ruling, there is no debate thereafter.
Yes. I'm being a little lenient because I can sense the frustration at my ruling. However, I'm going to move on. Mrs. Coote.
Okay. I understand you cannot ask or to provide your vaccine pass to access basic services such as supermarkets, public transports and central health services. And I read that you were exploring that for the Bluff. I was just wondering, is that being explored?
We'll come to it.
Oh, okay. No, I was meaning, is it being explored?
We're still on the first floor here in meeting venues, but Bluff's up next. So any other sorry, Peter, I know you said you had a couple of questions. So was there anything apart from vaccination status of councillors that you wanted to ask?
Yeah, question number 2, thank you. Are our appointees?
Same situation.
Well,
Same situation, final ruling. Any other questions you'd like to ask?
Concern over both those issues, but I'll bring it up. If it's got to come through the media, it will be through the media. But
And I'll remind you of the council code that we've just spent an enormous amount of money on behalf of the ratepayer in developing. Thank you. Any other questions about the first floor meeting area? Sorry, Councillor Scalp.
I just wonder if you can help me just about the cross-pollination from floor to floor, from first floor down to ground floor, interaction with unvaxxed and vaxxed downstairs. Is there a lot of cross-pollination, or help me?
Through you, Mr. Chair. So in terms of, just for clarification, are you meaning staff mixing?
Yes. With the public.
With the public. Not easily downstairs. It's secured, for example. And that we know when our staff have meetings with members of the public, should it be for a licensing manager's certificate or such like, all that's recorded in diaries. So we know who we've met and we know where they've been, and they are wearing masks through when they're coming through. We only have 2 people in a lift at the same time, etc. And they don't come to our desk areas or anything like that. But by and large, the majority of transactions where the public enter the building are completed and resolved on the ground floor.
So the short answer to that, there is cross-pollination.
Claire, can you add to that?
Councillor,
just to help me.
Yeah, Mr. Chair, I was going to add to it to say that prior to the last lockdown, there was a practice of a lot of staff coming into the building through the customer service centre, and some would leave through the customer service centre. The staff on the ground floor now would complain that they do not see staff who are entering and leaving the building because they are using the rear door.
Okay. That's a big help, thank you.
Anything else on the first floor? Right, now we come to Bluff.
So through you, Mr. Chair, the Bluff Service Centre is a little different in that it offers council library services plus also Lotto, New Zealand Post and Kiwi Bank. The advice we've had to date and at the time of writing was that we're the host for the Kiwi Bank and Lotto facilities, and so whatever is decided will be what is undertaken. So if that's a vaccine pass, that will happen. If not, they're fine either way. In terms of New Zealand Post, that has a little bit of difference. They advised us late last week that they were working with MB to see if they're defined as what's classified as an essential service like a supermarket or a petrol station. If that was the case, we could not enforce a vaccine pass for customers to enter that site. However, you could close and restrict your council and library facilities if that was what you wanted. But that would take out that part of the service. It would make it tough going. The capacity limit for Bluff is about 4 customers. So it is a small and unusual building, so just being cognizant of that.
Very special people.
It is a very special service.
Are there concerns with the safety for staff who are interacting in that space?
To you, Mr. Chair, our staff are really confident with using the tools we have in place now, such as we're concierging down there. They have great screens and things like that, at Perspex screens in place, sanitizer, 1 metre, the distancing rules, everything like that. So to my knowledge, there has not been any issues in that space.
Thank you. Councillor Lush.
Is it possible to have the library at a stage where it's just vaccine only and the rest of the area Is there room to do that admin?
Anything is possible, but but you would need to have a triage point at the front but you're actually going through to the back, and then you'd have to have another triage point to prevent. So it may have some additional staffing costs, but other than that.
And a supplementary question, is there an alternative entrance to the library?
Not that would be appropriate to use. So there's obviously a fire exit, but that's not conducive to using as a public entrance.
Thank you.
Councillor Clark.
Just a quick reflection. In recent times, government has decreed that New Zealand Post is an essential business.
Thank you. Councillor Lewis.
Thanks, Mr. Chair. Just a quick question. May I have a definitive decision when it comes to the council chamber on such committees as creative communities and wellbeing, which have public members in that makeup?
Claire?
Depends on the decision.
The short answer is they'll be operating under whatever decisions. So at the moment, it's a public facility. They would be a gathering in a public facility and would operate under those rules. If you added another layer of vaccine passport, then the people on that committee would have to meet that requirement as well. Although, I mean, as we've discussed, you could alternate between the two. But I think to the point of certainty, you don't want to be swapping if you can help it. You want to have a rule that applies at all times.
My point. Thank you very much.
Which I think leaves the animal control facility. No?
So
sorry, the
Chambers.
Bluff. I thought we'd bluffed it out. There we go. It's part 2 of Bluff.
Did you want to come? So, as you'll see, we have the Bluff Community Board meetings at the municipal chambers. We would need to have obviously a resource there, and similar to here, if we were to have the online channel would need to operate for the either elected members or members of the public to interact in that space. So it's a similar outcome to what would happen with chambers. The difference is, I understand, there's not the connectivity that we have available in this chambers by comparison yet.
Thank you. Questions about the Bluff Municipal Chamber? Animal control.
So the animal control or care facility is where we only have an interaction with the public if they have been to pay their infringements at the building here and they're going down to collect their animal. We cannot restrict contact altogether, obviously, to hand an animal over to an owner, but we take all the precautionary measures with PPE, etc. And it is by appointment only, so we know the person's coming, we are prepared and can manage the situation, but it's a restricted access facility. No members of the public are usually or should be in there. That's we have significant security controls in place in that space.
Thank you. Have I missed any spaces? If not, councillors, it's your last chance for questions of staff around any of the facilities. Councillor Pottinger.
My question is for Andrew, who introduced the subject. So it's not to do with any facilities, but it's actually Andrew started off using the words we are operating on guidance from the government. And now, this is what I'm struggling with, having done a 12-month dance with the Three Waters, and every fact that we've contested and the statements they've made have been false. I mean, I don't want to read them out, but I have 3 clear ones. I'm not going to go there. But why are we relying on guidance from the government when it's proven that it isn't that clever? I mean, seriously, you know, this is not a joke. We have just done the Three Water thing, and it's been a disaster, and factually, so many things were incorrect. Yet we have to listen to them, and the key element that is running this thing, and Dr. Sophie touched on it, is that the unvaxxed the walking unclean and need to be prevented, and that is what this council is going to decide on. Now, I really appreciate Doctor coming
There's
along.
a question coming, isn't there?
It is, and I'm saying, so why should we rely on guidance from the government?
We'll leave that one to the lawyer.
Simplistically, what you're complying with is your mandatory obligations. What you are considering is whether or not you vary from those mandatory obligations. You have no choice but to comply with the law as it's written. The decision that you're considering is whether to go beyond what the government requires. So again, back to that point, be very clear. You are making the decision yourself if you go down a path other than what we are currently doing.
And we're legally allowed to.
We can set, as the owner of premises, you can make the rules around access to those premises.
Thank you.
Michael will touch on some of the issues that raises, but
I'll let Michael do that and then I'll come to Councillor Clark.
Thank you, Councillor. Through yourself, the Chair, there are a few other facilities that we haven't touched on, which are the open spaces facilities that we have, like transfer station, recycling, drop-offs and public toilets, etc. We've not brought those up because it's impractical in relation to the mandatory requirement in relation to those. The other aspect is around our lease facilities. That's where there is a council-owned property that we lease out. Once it's leased, it becomes the responsibility of the lessor to lessee, sorry, my apologies, in relation to setting those controls in relation to that facility. So I just want to bring those ones up. I have the pleasure of not being a health expert and giving you advice around your finance and risk, which I think in relation to that gives a bit of a challenge in some of those respects. A good indication of where of the finance side is you've got a traffic light paperwork in front of you, which is in black and white. That is because I changed all the printers.
50 Shades of Grey.
Cost saving there.
It was a cost saving exercise. Look, one of the key aspects that we need to take into account is the cost of service, but also I want to touch on around funding aspect in relation to those services, because it may impact on some of the facilities as I go through those and discuss that with you. So we've touched on the increased costs. We've already had increased costs in relation to COVID and putting in protection measures in relation to the health and safety requirements that we've had to comply with. You've heard those mentioned: screens, concierge, etc. For a mandatory vaccination of our facilities, there will be an increase in costs in relation to those that are not within our budgeted LTP. The costs have been indicated in a number of spaces around increased staffing to man those resources, those particular access points, and those access points, if you've been to any of the facilities that have got mandatory requirements, there is one full-time resource that's sitting there having to do that. The other aspect that's been touched on is our technology in relation to rolling that out. Yes, we can roll some of that technology out now. Having said that, we are very limited. COVID has brought on a supply chain issue that we are in the same market as everyone else trying to get this equipment in relation to having the technology available, and that technology is limited. We can use what we've got available at the moment, but if we required any increase in that, we would be very stretched to get that technology in quickly. The other aspect you need to take into account with your cost of service is the drop in patronage. You will have aspects in relation to this where we will be looking at a drop in the service with the number of people that are going through in either scenario. We have not modelled that at this point, but I wanted to bring that to your attention that needs to be considered for each of these facilities. The other side I wanted to talk about was the funding aspect in relation to this. I wanted to take away one of the aspects, which is around a lot of the facilities are paid for via your general rates. Now, one of the aspects with a general rate is it is a rate on the property, and it is a provision of the service. It is up to council to define how they provide that service. So it could be via facility, could be through the a drop-in, etc. But it needs to be clearly defined to the public. There is one facility that is a direct charge in relation to a service, and that comes to the Bluff community charge. I wanted to draw that to council's attention. That is a direct charge to the Bluff community for those facilities and that service. So I just wanted to bring that one. There is no other, at this point, direct charge to facilities. We only the only other direct charges we have are around our 3 water facilities and our solid waste service. Probably pause there for questions. I do want to just check if we want to go through the 6 recommendations after that, but I'll pause for questions around funding and financing.
We'll get to that later. Councillor Clark.
Yeah, just 2 or 3 questions. When you talk about IT upgrades, are you referring just to duty staff having scanners with an app on it, or are you going beyond that?
I'm not going beyond that at this point, Councillor. Okay. What I'm talking about is the ability to get those phones and that technology for the frontline staff.
Okay.
Pretty much all of our IT equipment at the moment is utilised. There's the odd 1 or 2 that we could streamline out, but sure, we would be limited.
On the issue of drop-in service, which is patronage, I guess, when you go to do your modelling, will you be looking at the reverse of what you're suggesting? So the suggestion is if we have passports, there'll be some drop-in service, but there could be potentially, that's what I'd like your opinion on, a drop-in service if we didn't have passports.
Through yourself, the chair, look, that is not something I can provide advice on. That's a personal choice in relation to the public, sure, whether they do or don't access that from that perspective.
Yep. And the last one was the general rates, and I understand the need for general rates to deliver service. I get that, and certainly the library's got some alternatives there. But how would you expect, given that we face a pandemic, how would you expect a pool to have an alternative delivery to the core service?
Through yourself, the chair, a pool, the service that's provided in the pool is mainly user pays service. The facility itself is not at this stage. From perspective of the general rates, it is very clear under the legislation that it is a provision for service and not a direct charge for service under a general rate. If it had been a specific rate for those services, then yes, there would be a concern and an issue in relation to that.
Thank you.
Councillor Skelt.
Thank you, through you, Chair. Through Michael's point about finance and increased costs, just Richard, I wonder if you could help me around events and management. Do you perceive that the existing staff in the venues may be able to take up those roles initially to may help with that process, or do you believe that we would have to increase staffing levels over a period of time, or how do you perceive that, just given the current state of affairs?
Through Mr. Chair, it's a fairly easy one for us. We've got the luxury of being mandated and basically have to use a vaccine certificate verification service. We had a conversation early on and thought that actually the technology and that infrastructure is our responsibility as a venue, but we already charged our client for front of house services, and we consider this a cost of doing business. So the extra front of house staff will be passed on to the client. We have yet to make a determination whether it's appropriate or not for that vaccination checking person to be a staff member, or whether we just monitor it and it should actually be a security person. We're undecided on that, and we're just going to take a really close monitoring approach, but it will be passed on to the client, so it won't actually impact an FTE or rates funded impact.
And would that be the same for Splash Palace in that same working space?
Through Mr. Chair, obviously the Splash Palace doesn't have the ability to on-charge that service, so that, and it also operates under the fees and charges. So if we wanted to adjust our fees and charges to do some cost recovery, then that would be through the normal AP process. But at this stage, it would be an extra burden on the business to fund that.
Thank you.
Councillor Pottinger.
Thank you, Chair. Michael, get back to the level of service for general rates. So if a passport system came in for a service under general rates and property owners who weren't double vaxxed, this would be a significant change of service to them, as in it would cease. They couldn't go, couldn't use it. So the fact that it is a significant change of service to them, would this trigger the special consultative procedure under the Local Government Act?
Simplistically, the advice that is given by LGNZ at the moment is no. Of course, of this issue around it's you are entitled to have rules around how you provide the service. So it's not like, for instance, council no longer providing a pool full stop. It just has different rules around how it provides the pool. So it doesn't trigger those absolute changes. It's a tweak to the service rather than a removal of service, is the way that the interpretation is currently being read. Does that help you? It's splitting hairs, but that's the way the legal advice is coming down.
From LGNZ?
Yeah.
Okay, the same one's doing the three water thing. Yeah, okay.
Just to add to that clarity on the pool, to add clarity on that, for the pool, no matter what level we're in or what service we provide, whether it's vax or no vax, it doesn't actually exclude anyone from that service other than their own personal choice or their own personal risk assessment about whether it's safe to go there. So it won't be us saying you cannot come in because you're not vaxxed. There's no issue with that.
Oh, sorry, I misunderstood that. I thought a passport system would stop a non-vax person from walking in the front door.
Oh, sorry. Yeah. I was talking about the existing one, but yes, you are correct. Yeah.
And then their level of service would change.
Correct, yeah.
Councillor Soper.
Sorry, I wasn't indicating a question
Oh,
there.
my apologies.
Yeah.
Have I missed someone? Councillor Amundsen?
I'm not sure I want to ask this question because I'm not sure I want to know the answer. But I'm just wondering, where does the Local Government Act and the full wellbeing sit in our assessment of all of this and our requirement to promote the social, economic, environmental and cultural wellbeing of the community?
I'm happy to answer that, Councillor.
Didn't look like it.
Thought Andrew might have wanted to. From a full wellbeing's point of view, with every decision that council has to make, they have to take those into consideration in all aspects. So this is no different from that perspective. Mm. You have to weigh up the risks, and the benefits and the opportunities in relation to this in your decision making. So it is at the forefront of that decision.
And the only point that I would add to that is, I suppose, where I started, a lot of the things that are obviously crossing your mind is around the health and well-being of the community. Sitting around this table at the moment, I don't know that we have any better evidence as to the impact on the health and well-being of the community than that's been considered by the government when they came up with the framework. So clearly when they came up with the framework, when you look at what they're trying to do, which was to minimise the risk and protect the community, that is your sort of feeds into those health and wellbeing considerations. If you were trying to make a decision on what is for the best health of the community, you would almost need to get some specific advice on that. But it's there in your decision making. I'm just trying to guide you as to where you might look to get evidence of that from.
Michael?
I apologise to councillors. There is one piece of information that I thought you would be prudent to let you know that I had missed out, which was that in relation to our service centres for the collection of our revenues, our approach during lockdown is a good example to look at in relation to how we dealt with the fact that there are a lot of our community that do do pay by cash in the FPOS approach. During lockdown, we deferred. And in essence, there was a service that needed to be provided in relation to that in some way or capacity within Invercargill. So we acknowledged that during the lockdown period and deferred payments. So I just wanted to make sure councillors were aware of that in relation to decision making.
A useful reminder. Thanks, Michael. Okay, councillors. Thank you for your forbearance through the question section, and sincerely my thanks to the staff. So one of the reasons we're meeting this afternoon is around, I guess, the need for councillors to have more clarity around the position that went out last week, and ultimately there are some policy decisions that we'll be making very shortly. It is very clear that we have had good advice, that there has been robust discussion at a staff level prior to the writing of the paper, and various scenarios seem to have been thrashed out, which is great because that's been reflected in how you've all been able to answer the questions this afternoon. I'm going to give councillors the chance to make statements or give their position before I go into each of the recommendations individually, because I think I got a sense prior to the meeting that councillors wanted to look at things on a venue by venue basis. So is everyone comfortable with that process? Do I have a volunteer who wants to kick off? And I see that hand. And just as a reminder, you can state what your position is on the process. And I'm thinking of you, Peter, with the question that you wanted to ask before. And you can give your reasons behind it, but I wouldn't, in that example, expect a question. This is your opportunity to express yourself in the democracy before we go to a vote. So, Councillor Clark, thank you for stepping forward.
Yep, thank you. My position is I trust the government advice and their approach to the COVID thing. And I hear a lot of people, not a lot of people, I hear people in opposition, including the speakers today. New Zealand, from my perspective, is one of, if not the safest country to live in at the moment in a pandemic. And this is due to the government's very good stewardship. Let's not forget we have a global pandemic. The government's provided New Zealand with many tools to minimise the harm of the virus. So they are vaccines, border control, MIQ, social isolation, alert levels, mask wearing, now the traffic lights, and possibly the use of the vaccine passports. These are all tools to allow us to get a balance between having an open country where we have some freedom, but also safeguarding the majority of our systems. So I'm a strong supporter of using the vaccine passport tool in council because it avoids the opportunity for mass spreading and ensures clients are safer, not necessarily safe, but safer in larger ICC venues. So my support is for vaccine passports to be used in the pool and the library, but nowhere else at this stage, on the proviso that as we go further into the opening up of Auckland, we may want to reset the parameters on a regular basis and review that we've got it right for the other venues.
Just as a matter of clarification, Councillor, you would be excluding those venues, for example, like the Civic Theatre, that were already requiring it?
Yes, no, that's already been covered. So I'm quite happy with the status quo for this building and for Bluff, but certainly the library and the pool have large attendance rates, and so if we get that wrong, the potential for a super spread, as they had with Auckland with the Pacific Island Church scenario, gets really out of control. Given that in Southland we don't have a lot of facilities that may be available in others, so our nearest MIQ for people to isolate in, if they can't isolate at home, is in Dunedin. So I'm happy to go down the track of just having just for those two venues. That's all my approaches.
Thank you, Mrs. Cook. Do
I
you want to pull that microphone in, please, Barney?
I actually also trust the public health system advice. I do struggle with the comment that was made earlier around the unvaccinated claim, because I don't believe that's the case. To me, people have the right to be vaccinated or not. That's their choice, it's their body. And as we have a right to protect the health and well-being of our communities. And so that's sort of where I'm sort of sitting and how I feel.
So, just to seek clarification, Pani, you were suggesting that the passport.
I'm supportive of the passport, but I would not want to exclude people in certain places like the pool,
right,
for example, or the public library. But if that was the choice of my colleagues here, but that's key to play.
Right, so your position is kind of around the recommendations that we've currently got. Councillor Lewis.
I was of similar thoughts, Mrs. Coote. Things like He Wakatua, I think we should have passport. Because it's very difficult to maintain the spaces in areas like that. I know there's a number quantity. I tend to be on the more cautious side. I know we've had a public submission from two very skilled, very knowledgeable health people. Not necessarily my thoughts. We've all read so much about it. I think we should be guided by the governmental laws as much as we can down the track to have uniformity throughout New Zealand. I err on the side of caution. The pools, more room, I think would be lovely. The library, it's a difficult one. I find it very hard to be totally definitive across the board, I'm afraid, at this stage, but I would err on the side of caution and use passports where we can.
Thank you. Councillor Crackett.
Thank you, Councillor. Although I think this is a really awkward position to be in, because it's kind of like you're damned if you do and you're damned if you don't. I truly believe that people are really free to choose. Like I really strongly believe that. They're absolutely free to choose, but they're not free from the consequences of it. It's been spoken about today by the lovely Nikki. Personal responsibility is a huge thing when it comes to the balance of risk around how you are individually treating your own personal risk to COVID. But in doing that too, you're also putting the people around you at a heightened risk. And we do, like my colleagues, I do trust the government's advice in epidemiology and health around this. I think that if we made a move to make vaccine passes mandatory in our larger entities, that will actually segregate more people from attendance, because like Ms. Cook actually spoke about earlier, that puts another larger portion of the populace or our populace at risk as well. The data doesn't lie. We've seen it right across the world. That's why the government has indicated exactly what it has. It's a really delicate balance of risk that ethically I personally can't put more people at risk or make a decision to put more people at risk when I have something in my power, within our power, that we can do to try to reduce risk for the wider community. We have to take the lead from the experts, and like I said previously, when people in our community do become sick, I would really like to see this council be able to be agile in our response and tighten up on restrictions if we see fit, and just balance that comfortability of risk within our council. How much risk are we actually willing to take in the community? Where do we decide that break point is where the risk is too great, and we, like Ms. Coote has said, or Mrs. Coote has said, tighten those up as the risk becomes greater.
Thank you. Sir Tim.
Yes, well, to me, freedom is a word that's sort of sacred, and it's one of the great advantages we've got of living in New Zealand, has been pointed out. But there's times in your life when you have to are overwhelmed by the assault on our well-being that's taking place. And if you've got children and grandchildren, the burden of the decision that we're making tonight is enhanced. But nonetheless, my general sort of belief is that we've got to harden up in this case. We've just got to do the best we can, and the real answer I have to so many of the issues about data is we just don't know. And when you're interviewed and that and you say you don't know, they look at you like you're a leper or something. And we're going to learn a lot from this. And one day I think we'll look back on it and be able to say to our great-grandchildren, wow, a bit like those who faced the Depression and 2 world wars. We were there for the great battle against the plague that's infested us.
Thank you. Councillor Skelt.
Thank you, through you, Chair. A big thank you to the medical presenters this afternoon. They were outstanding in what they did say. But the contrary to that, obviously, is, for me, quite clearly, is this council needs to show some leadership around this issue. Because without a shadow of a doubt, being involved in one of the larger venues, what I've seen since Friday to today, in the venue that probably put through 4,500 people over the weekend, there's a misconception about people in the DV, the double vax. So of those people that came to the venue for councillors to give you some comfort, 95% of them were actually very au fait with being asked to be double vaxxed, showing their vaccination pass. We had a very small percentage. The next step of that, obviously, we're talking about a population of less than 10% that we're making a decision for on what we're doing unvaccinated versus vaccinated. I can't agree with my fellow colleagues around the government's performance around this particular issue and the traffic light issue. I state this, it's been appalling. From an information and communication, they couldn't run a hot bath on this particular issue in the sense of their communication. It's made it exceptionally difficult, and you've heard from Richard today, and it's exceptionally difficult for venue managers and particularly the hospitality industry. So that's why I've asked those direct questions today of the individuals who have experience in that field, if we could have some consistency. There's no shadow of a doubt in my mind that COVID's going to hit us without a shadow of a doubt, and we need to be prepared. We need to be consistent in our message and our communication and our delivery across all our venues. Without a shadow of a doubt. Our people, who are our most important asset, are confused. They are living in fear because this government has made an appalling, their communication around this process has been nothing short of appalling, in my opinion, in my professional opinion, of running a large multi-purpose, multifunctional venue. It has put undue stress on staff and the public across all of those venues. So the plea is for this council is to show some leadership, and I'm moving towards that all of our venues should be double vaxxed.
Councillor Abbott.
No, I'll come back to that, thanks. Just listening at the moment.
Well, we're doing the round table. When are you expecting to go?
Go where?
When are we expecting your comments, feedback?
Oh, just want to hear a few other comments, please.
Well, we're halfway around the room.
Yeah, I realise that. I'm not silly.
I'm chairing the meeting, Lynn.
I think a point
Do you want to have a say?
I think a point of order. I think that Councillor Abbott does have the right to speak at any time he wants to and not follow a sequence.
Councillor Soper.
Thank you, Mr. Chair. First of all, I do feel obliged to declare that I have probably had more access to the science and the data and the preparation and use of ICU facilities than other councillors. And I'm not going to go into any sort of lecture on that, except to say I'm sure our local DHB COVID experts would be happy to brief council and answer any questions about the accuracy of health information. And there has been some unfortunate comments about inaccuracies and falsities today that I am very disturbed by. I will also declare that I am of the opinion that the world has not managed the pandemic well. New Zealand had the chance to do it better, and we did. Coming now to council and where we are now, council has the option to determine whether to use the vaccine passport for our public facilities. In my opinion, and I'm very happy to declare this, council and for that matter other civic leaders do need to show a lead on this issue. We discussed that very point a few meetings ago when I think Councillor Lush raised the possibility of council taking some leads on the COVID issue. Here's an ideal chance for us to show that council is prepared to take a lead. I feel that we do have a duty to mitigate risk and to protect the health and safety of vulnerable people. I will refer in particular to the vulnerable immunocompromised people who we know will choose not to use our facilities, our library, our pools, our wakatoria, etc., if the unvaccinated have the access. I think we should not be in any doubt at all that while we may lose some unvaccinated people if we choose the route of requiring the vaccine passport, we will lose a large number of vulnerable immunocompromised people whom we know are large users of our facilities such as the library if we do not take the vaccine passport route. So I do believe that we as council have the ability and the duty to take a lead. It does fit within the 4 wellbeings consideration, and I have considered all 4 aspects of the wellbeings in saying this. I do think we have the chance to take a real lead on this issue, and that is where I stand.
Councillor Lush.
Yeah, I think that people out there are scared, and rightly so. You know, it's the tick-tock of the pandemic coming closer, and people want to go out and about and experience and have a normalcy that they can. And I think for the double vaccine, it gives them that normalcy. It enables them to go to the places they like to go, the majority of the people. Over 92% people by New Year's will be double vaccinated. Slightly lower down here, but that's because we've been away from the pandemic, but it's coming. It's in Fiordland, it's in Lake Monowai at the Green Hut today. So, you know, I think it's really important. And my understanding is the reason we've got vaccine passports for the libraries and the pools is to protect the under 12 and the under 5-year-olds that can't get vaccinated. That's why we've got it there, so they can go there and read their books and run around and swim and do their lessons and do that knowing that the unvaccinated won't come in there, more likely to have the illness and more likely to spread it. And that's the whole reason behind it, is to keep those people safe and keep normalcy happening there for them. So I think it's very, very important that we do pass this. I also think that just knowing with the pool so far is that going to swimming lessons at the pool, you're required to wear masks. Most people don't, or they have them on their chin. It seems as though the people, given the start, the self-regulating way that people can make the right choices for themselves, they don't do that. They seem to treat the thing as a whole joke and don't take it very seriously at all. Also, some comments about the council being discriminatory. I can't work out how it can be discriminatory because the vaccine is free and here and available to anyone. So I can't quite work out who it's discriminatory against. And that's the bit I can't quite work out. You know, 92% of people by New Year's will be double vaccinated. And those people want to get out there and have a normal life and want to have things as normal as possible. They're the people that were told if they get vaccinated, freedoms would be there for them. And I think it's duty bound for us to respond to that. So yeah, look, certainly. And I also think too, for listening to Peter's question or his attempted question, I think the councillors in this council chamber also probably err on probably the side of the elderly, etc. I think councillors have the right to come and debate policy in a safe where it's safe, where they're not nervous of people that are unvaccinated coming here to these meetings as well. So I think I'd also be in favour of the chamber being a place that you had to be double vaccinated to be. So yeah, as far as the service centres, I realise the rates are essential. I think probably I'd prefer those to be just open spaces at this stage. Thanks.
Thank you. Peter.
Yeah, thank you, Chairman. As an elected city councillor, I believe it's part of my job to keep our citizens and visitors as safe as we possibly can. And for months now, I've been urging people, both young and old, to be double vaxxed. Next Saturday, the 11th of December, we've got a huge race meeting in Invercargill, up to 4,000 people attending. And the organisers, who like getting people there, of course, to having people there to enjoy and to bet and whatever, I have made it very, very clear, 4,000 are attending, if they haven't have their double vax, they will not be allowed on course. I would also like to applaud the Stadium Southern staff, where there's about 12,000 people go through there weekly. And look, they've done a brilliant job by saying no vax, no admittance. Getting to Splash Palace, a large number of our elderly people go to Splash Palace, both male and female, and a lot of them for health and fitness reasons alone. Look, we must protect our elderly and all our pool users, and we should not be putting them at risk. So for all our venues, I'm including the library, Splash Palace, most definitely. If they haven't got a vaccine pass, sorry, you cannot come in.
Thanks, Councillor. Councillor Amundsen.
When it comes to the health of our community and our country, I think New Zealand has done a really good job. I think that it's been really easy to forget since August this year that for the 12 months preceding that, we've actually pretty much been living normal life here in New Zealand. And so I think from a health perspective, things for us have been coped with very well. And I've got friends and I know people overseas. I know people here who have lost family members, whose family members have had to live a very restricted life for the last nearly 2 years. And I think it's very easy for us to take for granted the position that we are in. I do, however, think that it's quite interesting that the government's requirements around public facilities appear to be the same when it comes to vaccination certificates or not, and also seem to be the same whether you're in the orange light or the red light, more or less, with a slight difference. However, like general businesses across New Zealand, we also have been given the same choice about whether we want to put in place vaccination certificates or not. And so I think it's been talked about already that people need to take some personal responsibility with how they engage in a COVID environment. But I think it's important that we have to remember as elected members that we also have a responsibility to our community to be making decisions that take into account some of the things that we can help and assist with. I think the 4 well-beings very clearly tell us in local government that we are here to promote social, economic, environmental and cultural well-being. And I think as much as the facilities that we run are public facilities, they are also for the public. And 90% of our public, more or less, has had their first vaccination or more. And I think that if we went down the road of having no COVID vaccine passports, then we are actually going to be disadvantaging the 90% of our community who have been vaccinated. On the flip side, by using vaccine passports in our facilities, like the library and the swimming pool in Hawakatuia, we are actively protecting the 90% of people who are vaccinated, but we're also actually protecting the unvaccinated people. And that's the 10% of people who choose not to be vaccinated and all of the children and people who are not able to have the vaccine. So my preference is certainly to have our public facilities like the library, the swimming pool and Hawakatuia as vaccine passport places. But I can appreciate that having downstairs here and the Bluff Service Centre, which are providing essential services, yes, and also are places where people are only going to be going for a short amount of time, and so therefore the risk is less if you're using the risk profile thing. Thank you.
Councillor Pottinger.
Thank you, Chair. First thing, credibility of the passport system. You require 2 vaxes to get that. Now, the person who got their second vax back in January this year is enabled to get a passport, and they have the same status as anyone who they are double vaxxed. No booster shot required.
Yeah, they're double vaxxed.
They are double vaxxed, so they've had their last one, but they're double vaxxed, and it is fact, and Dr. Sophie mentioned it, and it is fact, and I've heard it from people at Pfizer, that the vaccine wears off, and that's why you need the booster. The booster is evidence that it wears off after 6 months. Now, how can you issue passports to those people who have elapsed, clearly, 10 months from their last vaccine? It doesn't make any sense. There's no logic here. I mean, I like to make decisions based on logic, and that's one thing I can't quite understand. The other thing that's everyone seems to ignore, and it's sitting right in front of us as a control experiment, is supermarkets. Now, there is no reported factual transmission in supermarkets. There has not been.
There have been.
Yeah, there have been.
There have been. There has.
Yes.
Maybe one up north, but well, the transmission rate is incredibly low. So people of being vaxxed or non-vaxxed congregate there. You don't know who's vaxxed or unvaxxed, and it works. So this passport thing I struggle to understand it for the reasons I said before. I just can't understand it. If there was some consistency and they said, yeah, sorry, 6 months was up, it's like a warrant on your car, your passport is invalid, you need another jab, that would make sense. I would then buy into it. But until it makes sense, so to me it's not making any sense, I do not support the passport system whatsoever. And council facilities, the Civic and Hawakatuia don't worry me, but it does for the library and the pool, and I would like to see those non-passported for those very reasons. There's no logical case.
Is it a question?
Just a clarification. On my vaccine pass expires on the 1st of June next year, and you have to go for a booster, and then you'll have another vaccine pass issued. So it's like a driver's license or a warrant of fitness of your car.
Thanks for the clarification, Peter. Yep. Ms. Cook.
I don't know who was double vaxxed in January. It's a mythical person, because there wasn't vaccine available, and he cannot possibly have been double vaxxed this January. Not in New Zealand. Sorry. Facts are facts. We need to stick to facts. I think for me and for my family, the memory of the effects of the 1918-1919 pandemic are enduring in our urupa, in our cemetery. The parents and the 2 children that were lost, that were my partner's grandparents and great aunts and uncles, the proof is there. And what happened is that our people stopped going and doing the things with one another that they had done traditionally. They turned in and looked after themselves. But our urupa had not been used until that time. There had been no necessity to use that place. It was set aside by our tupuna for that purpose. So if we come forward, in my lifetime, I watched my cousins struggle with polio. I saw the effects on my aunt of polio. I lost an aunt to tuberculosis. Nobody in this room now experiences those things. And if you're under the age of 60, you probably don't even know that it was a real issue. But it was. You know, I had an uncle nearly died of measles. He was 35. That doesn't happen anymore, or it shouldn't happen in this day and age when we know about vaccination, we know about cause and effect. None of us can really escape the fact that COVID is changing and will continue to change until it doesn't have people to be vectors for it anymore. That's the, as I understand it, that's the nature of how these things work. The more people who have immunity, the more people who have protection, and the more sensible we are about how we do things, the less it's likely to spread and affect us. But the biggest thing of all is that as part of a 1,000-year business, I look at what I am doing to make things better, both for those who are older than me and for those who are too young to take those precautions, for whom we have a responsibility. So when I am faced with a kaumātua who is actively dying at this point, who has had both vaccinations and a booster, who am I to say to him, you should go amongst people who choose not to be vaccinated? I'm not talking about those who can't, those who choose not to be vaccinated because they believe that this illness does not exist, or that it isn't fatal, or any of those things. The right circumstances prevailing, it will be fatal. If you are predisposed, as many of our community are, you have underlying health conditions, you are so much more at risk. And I think that we as councillors or spokespeople for the people that we represent, so I am the māngai for Waihopai, I talked to them last night, we know that this may impact on some of our people, that they may not be able to go to places that they would like to go, but many of them feel unsafe about going into places where they have no certainty that the people with whom they are associating have taken the same health precautions as they have. If we look at our responsibility to those we represent, then the majority have taken, the overwhelming majority, have taken the opportunity to take up the vaccination. They have taken the opportunity to look at themselves and their families and make those decisions on their behalf, and on behalf of those who cannot be vaccinated because they are either too young or are compromised. The chances of us being the vectors to them, I believe, are much less if we take these sensible precautions. I am indicating that apart from the absolute spaces that must be retained open, and that means including this space, that we aim for vaccination passports to all our facilities for the betterment of all of the people of this area, not just the ones who are not vaccinated.
Councillor Abbott.
Oh, thank you. I fully agree with that last comment that the places that should be double vaccinated include this chamber. And I just want to speak about the immune compromised. I fall into that category. And we have penalties too. I mean, it's been said that the people that are unvaccinated are penalised, but we are penalised as well. And I've been a recluse, predominantly under medical orders, for 3 months or more. And I was told, certainly, that if COVID hit me, I would not be a candidate for staying at home. So you can draw your own conclusions from that. So my personal choice now is to not knowingly work with or be associated with the unvaccinated. And I know that might sound harsh, but the concerns are very real to me because, as I say, of me and many others who have compromised immune systems. Today, I think Councillor Lush touched on it about Fiordland. It's at our back doorstep. He first conducted a first week positive, and it was a week positive, and the second day was negative, but that's not to say that something couldn't develop. So I hold immense values in the right of freedom, and I believe that the unvaccinated, with the exemption of medical or other grounds like that, had the knowledge that if they weren't vaccinated, there would be, in some shape or form, penalties, i.e. that they couldn't attend certain functions. So I agree that we should adopt the system of vaccinations or passes throughout our public places, excluding the two chambers, the lower level, not the chambers, sorry, the lower level and indeed Bluff Service Centre. So that's my thoughts. I've thought long and hard, and I've thought about the position of the unvaccinated, but I still believe that people had the obligation to support themselves, their whānau, their family, their friends, and extended friendships like around this table. I think we should all be looking at a place that we could feel safe in, and a double vaccination, whilst I know it doesn't exempt you from catching corona, I think it's essential that this place also be double vaccinated. That's my thoughts.
Thanks, Lindsay. Similarly, as an immunocompromised person, I have a really vested interest in the whole situation. Although I hark back to what Mrs. Hadley said earlier on about keeping an open mind, and it's been interesting through this process. And I thank you for your questions, for your comments. I thank the staff for their input, and I thank the submitters who've come and spoken to us in public forum, because I've kind of, parts of me have bounced around. And I think part of the problem with society at the moment is that people are scared. And people are behaving quite poorly as a result of it, which is part of the reason why I've taken an unusually authoritarian stance around the process today about maintaining respect, and that's part of the charter that we all signed into, because people will have different perspectives. I really have a great deal of sympathy for those who are not able to be vaccinated. There are others who have a choice and choose not to for whatever position, whatever information they have, and you know, we had in Dr. Sophie earlier on somebody who has been an expert witness in a court case, and through RMA processes, I'm quite familiar with the process that you've got to go through to be an expert witness. But part of that decision-making framework that I quite often use is about how you apply weight. And I also look at what's been suggested by the Director General of Health, who kind of sits at the top of that pole as far as our country hierarchy goes. I think we've got to be continue to be nimble as an organisation, because I agree with some comments that the information, that the lack of clarity that's come out has been most unhelpful, and that's from central government. But I have always been really impressed with how nimble we've been as an organisation, and how we respond to it, how we've restructured the way we do business as a TLA and as a democracy. You know, the way that we are operating now is very different to at the start of this term, and a great deal of that is as a result of the first COVID outbreak, which I will take a moment to remind you included a particularly severe one in Bluff, which touched this very organisation. I respect those unable to be vaccinated. I accept those who make a choice not to be. I have no time for people who get angry with each other. Then I had somebody lunge at me because I chose to walk down Essex Street wearing my face mask. And it's like, really? Because I didn't have a crack at you for not wearing one. I think you make your choices. I maintained a respectful distance. I think I'll be nimble in how I respond to things with the impending outbreak, which will be here. If it's not in Fiordland now, it'll be here by the end of next week, once Auckland relocates to Queenstown.
It's Stuart Island.
I thought they were there. I say that lightly, but we know that by going through a vaccination process, you give yourself, to the best of my knowledge, and I don't have a degree, the best chance of surviving as an immunocompromised person, of not passing it on. But it's not a panacea. It's not a guarantee. It reduces, and there will still be people who are vaccinated who will test positive for COVID and the assorted variants that are in circulation, and those who don't. But I come back to a point that a couple of councillors have made, and that's around leadership. And from that perspective, I just really encourage people to get vaccinated. As I say, I'm triple dipped now, which makes me feel like an ice cream. Probably not as tasty. And in another 6 months, go through that process of being boosted again, and again, and again. As long as I'm allowed, that's fine. To be fair, the reaction that I've had has been nothing apart from that sore arm. I have seen very severe reactions in others, and I understand that. But we're being asked to provide leadership. The one thing I don't want to do is impose on people's democratic rights to participate in democracy and to come in and to be able to do the normal business with council that we had to suspend. And we held off on allowing rates payments to be made for a while during the last lockdown. I think it's imperative that our service centre in Bluff, that the Civic Administration building first floor, and even this room and our other meeting spaces are open to all. I know I have a choice in attending meetings here, that if I was not comfortable, and that would depend entirely on what's going on in the community, regardless of the person on the other side of the room or next to me or around me somewhere not being vaccinated, is actually going to dictate how I behave. There will be a time when I know I need to take more care, because the other person sitting next to me or across from me or around me somewhere who is vaccinated could also be positive with COVID. So it's that fine balancing act. With the initial indications of how we wanted to apply it when they came out, I struggled with Splash Palace. I kind of thought of it as human soup, and I don't mean that disrespectfully, but everyone's in the same water. And it's kind of humid. But I've really appreciated the explanations that we've had around that, and the different spaces from the staff. I've felt that the library is actually quite an open space, and as busy as it is, never that packed. It's not like going to Countdown, you know, when it can get phenomenally busy. Hawakatuya, our new Tauka in Kelvin Street. Similarly, people going in there and enjoying it, but not packed. And that's fine, because actually it's quite spacious. And again, if I felt uncomfortable in some places, I can remove myself. I mean, I did that last year after the release of the first lockdown, and you know, half of Invercargill went to Te Anau and the other half went to Queenstown. I was in Queenstown, where there were many places who, you know, they weren't really policing people scanning in and sanitizing, and certainly no distancing going on. And so I made a choice. Actually, I'm not comfortable in this space. I'll leave it. But we are in a position where we are expected to provide some leadership, and that is the point that we're at now, where we get to make those choices as the representatives for our community. I am confident that around the table sit people who do represent each part of our community and the different perspectives. And I'm comforted by that, because, you know, if it were to be a simple rubber stamping process, that would be a disappointment. It's a weighty, emotive issue, and I thank you for the way that we've gone through it so far. Hopefully at the other end, we will similarly pack it away and look to what it is that we have to deal with next, because there's no shortage of things. And the issue around COVID is a continually evolving one that we will, as I say, need to be nimble and respond to as the situation changes. So the first one's really easy. Oops, I thought it was a touch screen for a minute there. That the report, COVID Protection Framework and Vaccine Passports for Council Services and Facilities be received. I'm looking for a mover. Ms. Cook, Scout. I don't think we need discussion. Oh, Councillor Clark?
Oh, no. Just...
Okay. I'll put the motion. All in favour?
Aye.
Against? Aye. Carried. The second point is that we note Council operates public facilities as defined in the COVID Protection Framework. And again, I don't know that there's any way we can dissent from that. Councillor Amundsen?
I could move that one and the next one after.
Happy to second both of those.
2 and 3, thank you. That makes good sense. Yes. Thank you, councillors. Any discussion? Put the motion. All in favour?
Aye.
Against? Aye. Carried. Item 4 is that we confirm where venues, namely the Civic Theatre, Rugby Park and Scottish Hall, operates events, remembering there is a different definition around events that sits in that framework. That those events must comply with the requirements for events as set out in the COVID Protection Framework. I'll move that. Seconded, Councillor Kidd. Open for discussion. I'll put that. All in favour?
Aye.
Against? Carried. Gatherings at the cemetery or chapel. Again, these are relatively prescribed in numbers who can attend. That we confirm that where gatherings at the cemetery or chapel occur, these gatherings must comply with requirements for gatherings as set out.
So move.
Ms. Cook and Councillor Amundsen. Thank you. Open for discussion. I'll put that. All in favour?
Aye.
Against? Aye. Carried. The next one's where it gets a bit lumpy. So, with your indulgence, can I skip to 7? Because I think that will set a tone for us to come back to 6, how the next few go.
Mr. Chair, irrespective of what you do, I think the point is you're operating within a COVID protection framework. That's the overarching.
True, I'll take that. Mover? Councillor Scout, Councillor Lewis. Any comments? I'll put the motion. All in favour? Against?
Aye.
Carried. Right, now we're down to the ground floor of the Civic Administration Building. The recommendation is that vaccine passes be required or not required. Ms. Cook.
I would move that vaccine passes be not required for entry to the customer service.
I'll second that.
Thank you, Councillor Abbott. Questions or comments? I'll put that. All in favour?
Aye.
Against? Carried. Against? Thanks, Councillor Scalp. Noted. Resolution 8, that vaccine passes be required or not required for entry to the council chamber and or meeting rooms, first floor of the Civic Administration Building. Does somebody want to move in one direction?
I'll move that they be required.
I'll second that.
Moved Councillor Abbott, seconded Councillor Soper. Councillor Crackett.
May I comment?
Yes.
I think I've got a feeling that around the room the consensus for this is going to be that they are required for this council chamber, and not predetermining a vote, but that's just my feeling with what everybody's been saying as we've gone around the table. I think Councillor Ludlow, you touched on it, that I in no way really want to be in any way responsible for being prohibitive to democracy, so I want to make sure that when we are making this decision that we have our electronic means of zooming in for public forum, or making sure that our live streams are always consistent and available and accessible, and the public education of that accessibility to participate in democracy for the non-92% of us that is not vaccinated is not prohibitive in any way.
Thank you. Sorry, can you remind me who the mover and seconder?
Me.
Moved Councillor Abbott, seconded Councillor Soper, that vaccine passes be required for entry to the council chamber. Okay. Any further questions or comments? I'll put that to the vote. All in favour? Aye.
Aye.
Against? No. I think a show of hands around that one. All those in favour? If you could raise your hands.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Against?
1, 2, 3.
Thank you. Motion is carried. That vaccine passes be required or not required for entry into the Bluff Service Centre or library. Looking for a mover. And library.
Not required.
Sorry, you were moving that they are not required, was that Pania? You're moving that way? Thank you. So not required. Seconded. Councillor Amundsen. Councillor Crackett.
Thank you. I mean, we're viewing this under the same lens as we would for the customer service centre for the ground floor of this building, that it is an essential service and people need to be able to access it in that same manner.
So not required is the motion. Councillor Lush.
Can we make an amendment and break out the library as being separate, or does that become, is it practical as
part of the same building, really?
Yeah.
Look, there's a
councillors,
5 metre corridor. No good.
It's quite Trudy's trying very hard to be accommodating, but the practical reality is no.
Okay. So we'll leave them together. Not required for the Bluff Service Centre and Library is the motion. I'll put that. All in favour? Aye. Aye.
Aye.
Against? Carried. Sorry, Councillor Scout, you'd like yours recorded?
Thank you.
Thank you. And direction required for the Bluff Municipal Chambers.
I assume we'd treat that the same as the chambers.
Well, I'd assume nothing because it was different here. Who's moving?
I will move that.
You'll move. Well, yeah, I'm looking for a direction. Required. Thank you. Okay. So the mover is going for required for the Bluff Municipal Chambers. Is there a seconder for that, please?
Seconded.
Thank you, Councillor Soper. That's open for discussion.
Mr. Chair, even though it sounds contradictory, because of the technical difficulties for people zooming into or out of the Bluff Municipal Chambers, and because of the quite small group that actually meets at that time, I'm a little bit ambivalent about imposing vaccine passports on that, and I stand to be corrected, but I think the space is adequate for the number of people who normally attend. However, I think the technical, if we resolve the technical issues there, I would feel vaccine passports were necessary, but because we haven't yet resolved them, I don't want to preclude democracy.
Correct. Mrs. Coote.
We have no Wi-Fi, so we would not be able to adhere to that.
Councillor Lewis.
Just indulge me, I think we did pass that we would pay for Wi-Fi in the Bluff Community Chamber some time ago. And it was discussed at the Bluff Community Board at one stage, and it was, I'm pretty sure we passed it at the full council meeting.
Mr. Day.
Through yourself, the Chair, yes, Councillor, that is correct, and we're in the process of implementing Wi-Fi into that facility.
But it is not there yet.
Is there a time frame?
I think my comment would be that it's in a long line of technology projects, and without wishing to sound unkind, the value proposition for it, as opposed to, for instance, supporting councillors with iPads and other things, it's one of the lesser priorities. It's a harsh reality, I'm sorry.
So not in a hurry.
No, well, I'm ambivalent on that. I just thought I'd mention it.
Okay, the motion is that vaccine passes be required for the Bluff Municipal Chambers, which is Wi-Fi-less. Councillor Clark?
Just a further comment on that. I'm a bit uneasy, I guess, that we require a passport to come here, but we've got other options for people to zoom in and to live stream, and yet we're asking the Bluff Centre or Bluff area to sort of be at the end of a long list of IT needs. And I think that changes my view on it. Unless we can give some urgency to that Wi-Fi upgrade, then I'm probably going to be opposed.
I'm sitting in that camp too. Mr. Day. Sorry, Lynn, just a moment.
Through yourself, the Chair, I'll remind Council that they only approved the Wi-Fi, not for full live streaming option. It will not be able to be live streamed from that perspective. It is just Wi-Fi access.
Councillor Abbott?
No, I was just hoping that it could be a priority, that was all, but after hearing Mr. Day, well...
Councillor Soper?
Thank you, Mr. Chair. My comment would be that if we pass this particular motion to be consistent with what we have passed for the council chamber, then we have indicated that we want this to be the highest of priorities for the Bluff building to become, or to come up to the 21st century with Wi-Fi.
And streaming.
Councillor Crackett.
Thank you. I was just going to make a suggestion, if it wouldn't be too arduous, that perhaps the Bluff Community Board, while for the short interim while the Wi-Fi situation gets fixed, could come up here.
That's assuming that the community board and anybody wishing to speak to them have the ability to do that. Councillor Lewis.
Gee, that might not be totally practical, that Councillor Crackett, because the Bluff Community Board meeting started at 7 in the evening. We would not have the staff on board at the council.
Personally, I'm sitting in the no for this at the moment, but I'd revisit it when there's better electronic services. Well, it's been moved and seconded. I'm happy to test the motion. So no, well, you can't move an amendment against your motion. Not in no. It's a nice thought, and I understand the sentiment, Councillor. But I will test it. I'll put the motion. All in favour? Sorry, Councillor Soper.
Sorry, before you put the motion, can I just remind people that I think there is only one further Bluff Community Board meeting due this year. I think it is next Monday. And by the time of the next Bluff Community Board meeting, I would hazard, if we make it a priority, that the technological situation.
I don't know that we can guarantee that type of magic, Leslie.
Mr. Chair, I need the councillors to all hear Mr. Day's advice. Wi-Fi does not equal live streaming. Okay, I just want to be.
So remembering that fibre hasn't hit the Bluff yet.
Well, parts of it has.
Parts.
But not this part.
As somebody who employs a technical person who lives in Bluff, they are challenged after hours. So I'm going to test the motion. All those that support the motion that vaccine passes be required for entry to the Bluff Municipal Chambers, aye.
Aye.
Against? No. All right, we'll go back to a show of hands. Sorry, all those who support the motion that they be required, hands please.
1, 2, 3, 4, 5, 6.
Those against?
1, 2, 3, 4, 5, 6, 7.
Motion is lost. So therefore, by default, do I need a new motion? Yes. The motion that I will then put is that vaccine passes are not required for entry to the Bluff Municipal Chambers. Is there a seconder? Councillor Clark, thank you. Don't need to rehash it. All those in favour? Aye. Aye. Against?
No.
Thank you. Who would like their votes recorded?
Thank you.
Yes.
Councillor Kett, Councillor Skelt, Councillor Soper, Councillor Abbott. Have I missed anyone? Thank you for that. The Eve Paul Public Library. Councillor Emerson.
I'll move that vaccine passes are required.
I'll second that in that case.
Okay. Moved and seconded. All in favour? Aye?
Aye.
Against?
Yes.
No. Carried?
A vote recorded, please.
Yep. And mine. Splash Palace.
I move that vaccine passes are required.
Thank you, Councillor Kett. Is there a seconder?
Second
Councillor
that.
Skelt. I'll put that. All in favour? Aye?
Aye.
Against? Carried. Hawakatuia.
I'd like to move that passes be required for the entry to Hawakatuia.
Required. Moved Councillor Lewis. Seconded Ms
Seconded.
Cook. Discussion? Vote. All in favour? Aye?
Aye.
Against? Carried. The vaccine passes be required or not required for access to the animal control facility. I'll test this one with a not required, simply because it's limited access entry. Seconded Councillor Crackett. Comment or discussion?
I just think we should be consistent. I hear what you're saying, but I think we should be consistent.
Understand that, but there's already variation between different facilities.
I understand that.
Mr. Chair, the guidance does require you to provide an alternative access. You'll notice that the resolution is not for entry, but it is to access. It's difficult to see how you could provide an alternative service when you're talking about the handing over of a dog.
There it goes. Good luck. Have a run. And for those little ones that are really fast. Okay, I'll put the motion that it's not required. All in favour? Aye. Against? Councillor Scalp, would you like your vote recorded?
Thank you.
Thank you. And Councillor Soper, do you want your vote recorded, please? Councillor Soper?
I voted for that.
Oh, I beg your pardon. That's misinformation for you. It's everywhere.
I think you might be meaning Councillor Abbott.
No. He's in a different position. I was just going on what I read on Facebook. Okay, if vaccination passes are confirmed, this requirement be introduced from Monday, December 13. Moved Ms Cook, seconded Councillor Amundsen. All in favour?
Aye.
Against? Carried. Resolution 16, that Council ensure as far as practicable compliance with the COVID protection framework for all users of council property for gatherings, outdoor community gatherings or events as defined in the COVID protection framework. So moved, seconded by Mrs Cook. All in favour?
Aye.
Against? Carried. Councillors, may I close with the comment that while some people will be happy, Others will be equally disappointed. But I am comfortable that we have represented the very various views that exist within our community, and I thank you for the way in which you've conducted the discussion. We now have an in-committee meeting for the Infrastructural Services Committee, so I will close this meeting and thank you for your participation. Yeah, we'll take a 5-minute comfort stop, councillors.
Yeah, yeah, it's fine.
I'll tell you when to say aye.
I think, oh my God.